Habiba islasen para Kitodui tempui pas para ita dan ginilangit na bendisyon Contrai peligro na fansafuham Deus protege Island Guam Contrai peligro na fansafuham Deus protege Island Guam What's the matter with your head? Oh yeah. What's the matter with your mind and your side and whoa? Ain't nothing matter with your head, baby, find it. Come on and find it. With it, baby, 'cause you're fine and your mind and you look so divine. Come and get your love. 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 What's the matter if you feel right? Don't you feel right, baby? Oh yeah, get it from the main line. Alright, I said find it. Go on and love it if you like it.
Be healthy. Be informed with ITD.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
All right. Good morning, Guam, and the CNMI, and all over the world. 6:15. And to kick this one off here, local boys, Rock Bottom, doing the old Redbone. It's an old Redbone tune. Come and get your love. Anybody? No? Good morning, Sabrina.
Good morning.
Joined by my super-powered and mega-talented veteran news hound, Sabrina Salas Mantanani. At 6:16, it is the KUAM News takeover of Guam's favorite I-94 containing COVID. Good morning. It's the 29th day of April, Wednesday. And you can catch the show right here on the radio. Good morning, Guam. 93.9 FM in Agotnia. We are Guam's favorite I-94. Thank you, Andy Wheeler and company, for letting us jump on for this temporary radio show that keeps getting more permanent because our orders keep getting extended. It's like radio deployment. We start packing our bags, it's like, nope, in another month. Okay, fine.
Just when you thought we were
I know. It's just when I thought I was going to be able to sleep in on a Monday. Oh, well, it's worth it. Hey, also, there's an audio stream, Docomo Channel 10. We're on the KUAM News app, KUAM.com, streaming live. And last but definitely not least, good morning to our Facebook Live viewers at KUAM News' Facebook page. Tuning in from watching, viewing from right here in Guam, Saipan, Tinian, Rota, and of course, all over the world on Facebook. And as we always do, let's start the show with a deep dive into the day's COVID-19 news from the KUAM News team. Good morning, Sabrina Solis Mantonati.
Hafaday, good morning, everyone. According to the latest information from the Joint Information Center released at 11:15 p.m., Public Health tested 110 individuals for COVID-19 on Tuesday. One tested positive, with 109 testing negative. To date, there are 145 confirmed COVID-19 cases on Guam, with 5 deaths and 129 released from isolation. Public Health, in the meantime, will be back at the Estumbo Gym community testing site again today, and this time it will be open to everyone experiencing COVID-19 symptoms. The testing is from 3 to 6 p.m. On Thursday, April 30th, testing will be conducted for Central residents at the Mangilao Senior Center from 3 to 6 p.m. and then again on Friday, May 1st from 1 to 4 p.m. For Southern residents, they can be tested at the Agate Senior Center. The testing is free. All residents with COVID-19 symptoms are urged to bring an ID. Governor Lulian Guerrero acted on several measures that were passed by the Guam legislature during an emergency session held about 2 weeks ago. The governor vetoed Bill 326 related to COVID-19 hazardous differential pay and double pay for essential employees responding to COVID-19. The bill had passed unanimously. The governor acknowledged the measure's good intentions, but says she was forced to veto it because it could potentially do more harm than good, as it could cost an additional $36 million just for payroll. Quote, from a cash flow standpoint alone, meeting this new multi-million-dollar liability in the best of times would be extremely difficult. Meeting this obligation now, when the world economy is at a standstill, would cripple us. Governor Leon Guerrero said in her veto message, adding that any attempt at an override would likely result in starting the furlough notification process under Guam law. Quote, surely this consequence is not something the legislature intended, nor is it one that any of us desire. The governor also vetoed Bill 333, which calls for transparency in the way local and federal financial assistance is being spent for the COVID crisis, and also calls for the expedited payment of tax refunds. In her veto message, the governor stated a local statute commanding the executive branch to do what federal law already prescribes should not confuse these processes, adding the District Court of Guam has previously made it clear that the government of Guam may receive direct appropriations from the U.S. Congress under provisions prescribed by them. Placing additional requirements on the use of these funds is an overreach of legislative authority. Bill 333 was introduced by Healthcare Committee Chair Senator Therese Terlahi, who says over the last several weeks she and her colleagues have written countless letters to the governor and members of the cabinet asking for clarity on the administration's plan to purchase more tests to provide personal protective equipment for our frontline workers, to expedite economic relief for those unemployed, and to advise how $129 million in federal relief will be prioritized during this crisis. Quote, it is perplexing to me why the legislature, a co-equal branch of government, and the people of Guam would be denied this basic information while they continue to suffer and instead be told by the administration to submit a FOIA. Senator Terlahi adding the unprecedented power and money controlled by a handful of public officials as a result of this public health emergency will have long-lasting repercussions for every individual on Guam. The legislature's unanimous call for increased transparency is a whisper compared to the public's growing discontent and demands for truth and real relief. We must use facts to dispel doubt about their government and restore a partnership worthy of the people's trust and cooperation. Quote, I urge my colleagues to stand firm on transparency and expedient reporting of COVID-19 expenditures. Now is not the time to blink or look the other way. Also vetoed was Bill 336, which would have expedited critical medical supplies for the pandemic. The governor vetoed this bill in the interest of statutory economy. Quote, although the short title brands itself as a measure that would expedite the procurement of critical emergency equipment, the actual language of the measure does not grant new procurement authority under the law. Furthermore, every healthcare worker assisting a COVID patient has the required PPEs and other equipment. At our current burn rate, that supply would last about 1 month. Despite this fact, Guam also has standing orders which certified PPE providers, and the same is true for other vital equipment. The measure, again introduced by Senator Terlahi, reacts to the veto, saying she will not pursue an override, but we need the executive branch to account for the money already spent and to demonstrate that these critical supplies made it to the frontliners where they belong. The island's chief executive did sign 3 bills into law, including Bill 324, which suspends the 2% general fund deposit into the rainy day fund requirement. Bill 332 and Bill 339 were also signed into law. Both measures are related to education, specifically removing requirements for service learning and instructional hours. The Federal Emergency Management Agency now has 10 boots on the ground responding to the COVID crisis on Guam. FEMA spokesperson Frank Mansell says in addition to personnel, the federal agency has provided thousands in medical equipment, according to the breakdown, and this is from the strategic and non-strategic national stockpile, as well as from donations. Guam has received 56,000 N95 masks from FEMA, 25,000 surgical masks, 10,000 surgical gowns, 8,000 face shields, 93,000 gloves, 3,000 biohazard bags, and 59 ventilators, and 2 50-bed federal medical stations. Now, the following list is what GovGuam is requesting from FEMA. They are shoe booties, hand sanitizers, face shields, coveralls, disinfectant wipes, and tents, which is currently being reviewed. As you heard from Frank Mansell yesterday, those tents are for the homeless population, which they are currently looking at staging them at Paseo. Well, we have covered the headlines of residents barely hanging on as they wait for federal assistance, calls for transparency. But here's a story of hope and recovery. This is a video produced by the Department of Public Health sharing the story of COVID survivor, 92-year-old Elvira Cagle, and her daughter, Jackie Nagencast.
Well, I thought I was coming from the beginning. I thought I was just coming down with a cold. And that's what I just thought, because usually when I have a cold, it just moves right in, it takes over settles in my bronchial tubes. And so I was expecting that, and usually what I grab is Zicam, and I take that during 2 tablets. In the morning it was gone. And then it still wasn't back to normal, the way I thought. And did I have a slight temperature?
One day.
And Jackie thought, no, I better take you to the doctor. We better go check and see for sure. And he put the swabs up my nose, and then we had to wait to send it to Hawaii then. And we had to wait. We didn't get it till Tuesday. And then they called and they said I was positive. And I was expecting always congestion. They keep talking about congestion in the lungs and the chest, and it just never got real congested. Just one day that I felt a little bit tight.
It's positive. I mean, I could have dropped the phone because I so did not see that coming. He had prescribed for her an antibiotic because one of her lungs looked a little bit iffy on some congestion setting in, and so she started taking that. And then when they called and said, it's positive, we were just all so surprised.
A week before, I was only 2 places because I usually don't go out much at all. And that's why I really thought I was pretty safe. I go to the ladies' Bible study on the Thursday, and every Friday I go to have my hair done, to shampoo, and she sets it.
Something's come into our lives that I didn't want, and it was maybe fearful about. And of course, our children were saying, Mom, if Grandma gets the virus, Mom, if Grandma gets the virus, it's not going to be good for her. We could not have her. And, you're aware of all of that. And yet, what can you do? You do your best and know God does the rest. And so it's ultimately in His hands. Our health always is, every moment of every day. So all of a sudden that comes home to you and your mind just starts going, okay, what does this mean for all of us? And especially, what does this mean for her?
It was sort of in a way scary, but I felt so good having Jackie with me. And then we had access, they call from the health office, that really meant a lot too. That we knew if I did really something happen quickly, we had somebody to get in touch with. So really appreciated the girls in the health office that were calling and trying to be of help if we needed it.
But really, there was never a fear of ourselves, and it was just trying to care for her, knowing that this could really be a difficult thing at 92 years of age to fight this strong of a virus. And so that's just what we did. We really started going through. And I'll tell you, one of the biggest blessings was that we didn't have to send her anywhere else to isolate. And at first we got that message. And when I heard that she was going to have to leave and go somewhere else, and we wouldn't even be able to visit, I thought, oh no. You know, that in itself, if anything, will be her downfall right there. She's so used to being with us, and we're used to being with her and caring for her. And without even a visit, I knew that would be so hard. And we prayed that night, God, you know, you're in control of all of these details surrounding this whole situation. You've allowed it. You have a plan for it. And so you show us.
What are your general thoughts on how public health supported you and your family?
They were very, super supportive right from the get-go. We started getting calls. We started hearing their concern. And they wanted to know whatever they could do to help us. That was really a blessing to us. Although we have some people around us that were willing to go to the grocery store and bring it to our door and drop it off or whatever, they were asking if they could do that. Can we get anything for you? And they checked in. My mom got 2 calls every day, morning and afternoon, to see how she was doing. The rest of us each got our own phone call to see how we were doing, always reassuring us what to do in case we had any symptoms, what to do if my mom's symptoms grew worse. And so we always were in the know, and we were always very supported by a group of people who were there for us at just a phone call away.
Now, we saw Nurse Kim earlier, so how has public health been in terms of your support to you?
Oh, I'd say very good. They're very good, very helpful. Just giving you a good feeling of knowing, well, they know more than we do. In the event that I did feel I really ran into some problem, but so it was just a support that meant a lot, and really we appreciated it. And if Jackie had any problems or something, because this was the first adventure for us, and I didn't hear of anybody else going through it, so we could go to somebody else that had experienced it, you know. And it was new, and it was an uncharted journey.
COVID survivor Elvira Cagle and her daughter Jackie Nagencast. According to Public Health's dashboard, there are 129 COVID survivors. In news from the CNMI, Governor Ralph Torres, you may know that he extended his public health emergency declaration for ensuring protocols for social distancing are in place. The CNMI Nutrition Assistance Program will be distributing benefits through drive-through service at their office locations in Eslito from 8 a.m. to 3 p.m. from May 1st to May 15th. This means eligible households will be issued their benefits to them while in their vehicle. The purpose of this drive-through service is to ensure the safety and protection of the public and NAP personnel from COVID-19. There will be no walk-in service during the drive-through period. As for an update on the USS Theodore Roosevelt, the number of active cases remains at 955, with 14 recovered. 1 sailor remains at Naval Hospital, with 0 sailors in the ICU. In national news, the Trump administration is laying out ways states can reopen sooner, including an increase in testing. Natalie Brand has more details from the White House.
And our financial institutions. President Trump is meeting with Florida Governor Ron DeSantis in the Oval Office as states begin to lay out their plans for reopening.
We recommend that they do it as quickly as possible, but safely. We want everyone to be safe.
Monday, the White House released what it calls a blueprint to increase testing. CBS News has learned the federal government is expected to supply states enough tests to screen 2% of their population each month. It still leaves testing plans to individual states, but some health experts say the federal government should take the lead.
I would much rather have them decide what are the policies for surveillance screening, who should be tested, how we do our testing, and how we prevent a significant second wave from happening than leave it to the states at the present time.
While the White House says states should follow medical guidelines to reopen, the Department of Justice could be taking states to court over shutdown orders. Attorney General William Barr sent this memo to U.S. Attorneys General directing them to be on the lookout for state and local directives that could be violating the constitutional rights and civil liberties of individual citizens.
He doesn't want people to be held up when there's no reason for doing it. In some cases, perhaps it's too strict. He wants to make sure people have their rights and they maintain their rights.
President Trump is scheduled to hold an event this afternoon with some small businesses receiving help through the Paycheck Protection Program. but hundreds of thousands are still waiting for relief, and the rush of applications crashed the online portal just minutes after the program reopened Monday.
The launch this week was a little frustrating. You have banks that are desperate to help their millions of small business customers and clients all across the country.
The program is also under scrutiny for who got loan approval in the first round. The Los Angeles Lakers, one of the latest to return the money. Natalie Brand, CBS News, the White House.
Stephen Mnuchin says the government will perform a full audit on any company taking out more than $2 million from the Small Business Loan Program. And finally, in your Banking 6-7 report from Bank of Guam and Coast 360, the Bankers Association is assisting the community to cash their stimulus checks, and check cashing is allowed for non-customers at the Bank of Guam, Bank of Hawaii, Bank Pacific, and First Hawaiian Bank. That's your 671 banking tip from Bank of Guam and Coast 360.
Thank you, Sabrina.
You're welcome.
Hey,
You're loud.
all right, sorry. 6:32. That was a deep dive into our day's COVID-19 news. As always, a big show for you guys. We're going to speak to some of your village mayors, to talk about community testing, which is ongoing again today. And we'll have more info on that. We got some pics from Estumbo testing yesterday, and it looks like they were able, those 100 tests, was that all from
2 batches?
2 batches from the community
Well,
testing.
it said includes samples from, it included samples from Estumbo, Dededo.
Yeah, when the word came down from the Joint Information Center last
Jason Salas, everybody.
Hi, good morning, everybody. What's up? What's up, Facebook? It was after 11, and JIC even was apologetic, and they said, the reason why this is coming out so late is because there was such a huge volume. To date, this is the largest number of samples that has been recorded by GovGuam, but they said the overwhelming majority, I believe it was 86, came from the Estumbo Extended Testing Center. 24 of those were from hospitals and clinics. So that was the breakdown of that.
Okay. Yeah. So definitely we have the community testing today. 82. You said 86.
86.
86. That's great news, I think.
And 85 of them were negative.
Yesterday was for Estumbo and for Dededo and Jigo.
Right. And then, so what is today?
Today's for everyone at Estumbo.
Okay.
Gym.
So again, that's 3 to 6.
3 to 6 for people who have COVID-19 symptoms, flu-like symptoms, loss of taste, loss of smell. Go to the Estumbo Gym, 3 to 6 p.m. It's for everybody.
And hey, you can see we put a bunch of pictures up on our KUAM News Instagram account. It's easy. It seems pretty quick.
Yeah.
I wouldn't.
Swab up your nose.
I wouldn't say it's painless. It's uncomfortable. Okay, it's uncomfortable. But for all my men friends out there, remember, women birth babies out of their bodies. Okay, so we can take a little swab up the nostril.
Okay, sorry, I just want to jump back in because it was, a month and a half ago when you did that story, when you did the drive-through. I mean, the world was a much different place then.
Yeah.
We've also put up pictures from our friends up in the CNMI of, their drive-through, and apparently the way they do it, too, is they allow you to recline your chair if you're driving and do that so that your head can be at a much more comfortable angle. Dr. Hoan was here the other day, and he goes, I'm not going to sugarcoat this. It's not extremely painful. It's not excruciating. It is uncomfortable, but can you just say from your own first-hand or first nose experience exactly what it feels like?
Okay, it kind of felt like if you were digging for a booger, but way more extreme and way deeper.
Now that's a great answer.
I'm just saying that it was uncomfortable, Bree. It was a little sharp, not sharp, but again, if you ever hit yourself in the nose and you get that kind of you're gonna cry and sneeze feeling, that's what it felt like.
Have you guys ever been tested for strep throat when they take a throat culture? They basically take a long Q-tip and they just they just tap the back of your throat. I believe it's kind of the same thing, so it's so fast.
Okay, so there you go. 3 to 6 Estumbo at 6:35. We got to take a break, and we're going to go down to Agate before 7 o'clock and talk with Mayor Kevin Siswico. It's the KUAM News Takeover, Guam's favorite I-94. Good morning.
Be healthy. Be informed with ITD.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
Self-storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Hafaday Guam, Adriana Cotero here, and I am currently reporting from home. And I encourage every single person in this community to stay home. COVID-19 cannot survive if we do not feed it, and that means staying home and washing our hands. Now, I know I've heard people my age in their mid-20s say, it's okay, we're young, we're healthy, we have strong immune systems, we could fight it. That's not true, and we also don't know who we could potentially be exposing. The only way that we can fight it is if we stay home. It is our duty to stop the spread and to stay home. Be safe, Guam.
Self-storage, conveniently located near the Harmon McDonald's, offers fully covered loading and unloading area with individual pin-coded gate and door access. Call us today at 648-7867 for more information.
Specialist Joshua Mansonotia. I can't wait for him to come home. Keep us safe and stay home.
I miss my daddy, and I can't wait to see him. So keep us safe and stay home!
with ITD.
The 29th day of April. We don't know yet if there's going to be a press conference today. Of course, the press conference yesterday canceled because the governor was in a series of recovery meetings. And wow, the comments on our social media were just crazy. And I guess what they were basically saying was, is there anybody else who can sit down and, answer questions for the people of Guam? Is there no one else? I mean, that my social media is blown up. We saw it here when we made the announcement real time yesterday during the show. So we don't know. I mean, they're unveiling this recovery plan tomorrow, right, Sabrina?
That's the plan.
That's the plan, to unveil the plan tomorrow. It remains to be seen if the plan to unveil the plan will go according to plan.
And the plan, of course, is based on the results from tests, and we're hearing it's going to be sort of like a gradual reopening of the economy,
right,
and businesses on Guam.
There was a document floating around yesterday. I know we saw that about, and it was all over so many different chats that I had. A list of recommended non-essential business openings, right? And so what we had heard was this document was part of what the Chamber of Commerce had recommended to the governor. Of course, Chamber Chair Christine Boleto is on the governor's economic recovery group, and also on, I believe, her recovery panel of advisors. She's on one of those groups, or both of them.
There's like two, right?
Yeah.
So.
So I guess they had made the recommendations to the governor. Of course, the governor has their own people, and I'm hearing what's happening is they're just kind of trying to hammer these things out. And so these gradual reopenings, it's not going to be like they flick a switch. Okay, everybody, we're open. Run out there. No, it's going to be...
I hope not.
Yeah, I hope not. I mean, it's going to be based on triggers. And I guess the triggers, what they're saying is it's going to be like number of days with declining positive cases, or number of days with zero positives. And so I think it's important to stress baby steps is the concept. And just, keep listening. But what's happening this week with the community testing is a key part of the governor's plan to reopen Guam gradually. Because remember, there was that exception that we're going to talk about reopening Guam incrementally, but first we want to be able to go out and test as many people as we can.
And already we've seen the roadblocks. They've discontinued as of yesterday.
Right.
So that's a step.
Could I actually ask you? I'm doing like a real life Facebook comment.
Jason
right here.
Solis, everybody.
Yeah, because I'm an ardent fan of the show, right? So
Okay.
I wanted to ask a real life Facebook comment.
To participate.
I've seen some chats of my own and everything. People are saying that they were hearing that the way GovGuam is actually breaking this down is these meetings that the governor is in. They actually have separate committees for different industries, because obviously a grocery store is a much different private entity than a bank, which is a much different private entity than a beauty salon and everything like that. So they're dealing with these on an industry by industry basis, and logistically, that's a lot of work. That's a lot of back to back meetings. So
It's a lot of Zoom, huh?
Yeah, that's a lot of. So that was the understanding from some people, and people are passing it around like WhatsApp. If that is the case, and that's the way like they're breaking it down, it's going to be like a couple days of these meetings, before they finally get the majority of the word out.
Yeah.
No, I think they have been meeting though.
A series of meetings, Jay. Just one after the other, like boom, boom, boom. We're like the Zoom is smoking. It's so hot. It's burning up.
I hope they got the paid plan.
Do they? So yeah, that's kind of and if you look at that list and just talking to people with the chamber, I think one of the proposals that was being proposed to the governor was reopening of. This is the one that really caught my ear, Bree.
Which?
A reopening of shopping centers. Like the mall, like Gannett Shopping Center, the GPO, whatever. And the argument was kind of made that shopping centers and these malls are better equipped to deal with the influx of people, to institute screening measures like temperature scans or hey, Do you look like you have any flu-like symptoms? Yes, Jay? You're on. Yeah.
Oh, sorry again. You know, it's one thing I was thinking about because, of course, I grew up in Dededo. I'm a total mall rat, right?
Right,
Worked at the
right.
mall like 3
Yeah.
or 4 times in high school.
yeah.
I'm actually wondering, and I've had this conversation with a few friends of mine. I want to pose the question to you guys. But, you know, with these malls having so many different points of entry, you would think that one, they would just say, okay, well, like say the Micronesia Mall, the only way you can get into the mall is maybe from the bus depot side.
I don't know if they could do that though, because of like the fire.
Yeah,
other stuff.
and you're gonna have people that say, okay, I'm here with my mother, and she's in like a wheelchair, and it's unconscionable for me to go all the way around from like Payless or something like
Yeah,
that. That's a logistical problem. But also, the question I had is, if the mall's open, because you would assume that at least initially, the food court probably will not be open.
Yeah.
Yeah,
but,
you would think
but
so.
That's what I was.
Oh no, but here's the thing.
Yeah.
When the mall does open, when the malls do open, what does this mean for the restroom facilities? Do they have to open those by law to give people like an option if people do need to use the lavatory? And if so, what are public restrooms going to mean for the future of social distancing?
And I mean, these are all things that I'm guessing probably are coming up in those meetings. But you know, going back to the idea that was proposed to reopen the shopping centers, what I had heard was that it would be in a way where loitering is not allowed. Because, you know, people, when they reopen, like, for example, the mall or whatever, what's going to happen?
Stroll.
Everyone's going to go hang out at the mall all day. Well, I don't think that according to the recommendations that were made, I don't think that's going to be allowed. It's going to be like get in, get out. Food courts would also be closed and available only for, you know, takeout
They're not
orders.
going to have the little performances anymore at the mall.
At least not yet. And then so what they're going to do, and we only know this because this is what the governor said in the press conferences, is when they do these non-essential reopenings in increments, when they reopen, for example, like the shopping centers. So they're going to monitor, I guess, traffic and then do some testing and kind of gauge how much of an impact, if any, the incremental reopening of non-essential businesses has had. And then when they get the test results and stuff, then they make a further determination based on all the other testing and the results that's going on.
Yeah,
So
you could do like a drive-through shopping or something, like order your stuff online and then drive up and pick it up. Or
yeah, I mean, businesses are going to get more creative. You think they're getting creative now? I mean, all these you know, restaurants fighting for our takeout dollar. I mean, they're going to get more creative, and they're going to have to find ways to basically bring their services to their customers.
Yeah.
650. Also,
Everything's is gonna. Well, it has changed.
right.
But
I mean, even in the last 4 days, you know, things have changed. It's a rapidly evolving situation. I just got a Ross message.
Did you really?
Don't start asking about Ross.
Oh,
Haven't even.
I haven't gotten anything from Ross, really.
No, a WhatsApp. One of my aunties.
Oh.
So let's kind of share who we got coming on the show for you guys today. We're going to talk to Linda Pinko DeNorsi of the Department of Public Health and Social Services. She's coming on 7:15, talk community testing. We also have Dr. Felix Cabrera of the Governor's Physicians Advisory Group. I know there was a meeting last night.
Right, that's what Dr. Hoa said.
Right, and so we're also going to talk to Dr. Hoa. And then this morning, going to have a conversation with the Legislative Health Committee Chair, Senator Therese Terlahi, and get her take on the governor's veto of both of her bills.
The transparency bill, medical supplies.
Yeah, we put those veto messages up, right, because they're pretty snarky.
I requested that they be posted last night.
Yeah.
So
And so, of course, you know, Bree had read a bunch of that in the news. We'll do a deep dive into news again at after 8 a.m. But, wow, what a message. What a message.
Well, you mean like 36 million? It's a lot of money.
Yeah, and so you were talking about the frontliners and this bill with the Vice Speaker. I also put in to ask the Vice Speaker, Talina Nelson, if she could call in, so you know, hopefully we'll hear their side of it.
What was her bill? 326, I think.
Yeah,
and
that was
had
the
that
hazard,
sliding scale,
right.
the sliding scale differential pay, and then it had the double pay.
Right, and that's something we haven't really been able to get to the bottom of. Is this idea, and I guess from what we're hearing from GovGuam workers, that you get paid double time during an emergency.
Yeah.
Okay, while, you know, just for context, before we move on to, you know, our interviews and, you know, talking to the newsmakers and everything like that, The comments right now going really, really crazy about people's opinions on the opening of malls.
Right.
A lot of people right here.
Let's read them. What do you got?
Yeah, apparently not business owners. Let me get my phone. Yeah, but a lot of people are saying you should not open the malls yet. Oh,
Yeah,
thank you.
Jay, I'm pretty sure there are even some business owners who are like, we want to,
Yeah, well, and there's some people that say release the stimulus checks before we can do that, because what's the point of opening the mall if we have no money to spend? People are saying, economically, how will pricing change, if at all? Vivian Decimito, there you go. My eyesight's just bad at my age. How about reopening of the church? That's a very good point.
I could just hear my grandma. You guys talking about reopening the mall before reopening the church? Ooh,
Yeah.
boy.
But yeah, but basically the people taking our cue and they're just saying like, we want to hear your opinions on reopening Guam. So the malls are the big topic right now.
Yeah, and that's kind of like one of the ones that I know that the chamber has recommended to the governor. And like I said, they're not. This is a discussion thing. They're not going to open the doors and everybody come on in. But it's kind of like what Simon Sanchez said yesterday. It's a chicken and the egg kind of thing, where you want to reopen the economy, but no one has any money. So what do you do?
And really quick, before we move on, some people are saying because at the mall you can do a great variety of things. Obviously, they're saying, what about haircuts? A lot of people are thinking about that. In the Chamber of Commerce's proposal to the governor early last week, they were saying that services like that,
right?
They're actually saying you have to do it by appointment only, and preferably a few days out, so that they can kind of like balance their load.
Or if you're the governor, you can have a friend come over and do your hair.
Don a
up.
PPE and.
She got a good friend. That's like a professional job. So yeah, I mean, we talk about this, you guys, and I can understand that people are kind of freaking that. Hey, we just started community testing, and already we're talking about it. And this is the recommendation that was made to the governor. So hopefully, when we get Dr. Felix on and Dr. Hoa, them being part of the governor's physicians advisory group. Now, I don't know if that group is on the recovery panel of advisors, but they all rub elbows with each other. So
I think Dr. Mike Cruz is on the recovery advisor panel, and public health, Thane Hancock, because it has to be approved by public health.
Right, and so basically this idea and any proposals from the Economic Recovery Group or, the Chamber of Commerce, they get vetted through these groups, they get sent up to the recovery panel of advisors, and the medical professionals who are really the ones that are calling the shots in this public health emergency.
Yeah. First and foremost, it's the health of our community.
Right on.
And second to that is the economy.
Okay, so let's now go down to Agate at 6:56, where we have Mayor Kevin Siswico, fresh off his morning walk. Good morning, Mayor.
Good morning.
Good morning, Chris. Good morning, Sabrina.
I guess, first of all, how was your walk? It's a good time to get out and stretch the legs, right?
Oh, absolutely. Yeah.
How's your village looking this morning, Mayor?
Good. A little wet down here, but other than that, it's a beautiful day. Can't complain. We're alive.
Right.
We are, yeah.
So how are you preparing for Friday?
Well, Friday we had a meeting with the public health folks. They actually came down yesterday, Monday. They came down. I'm sorry, they came down on it was Monday, I believe. They came down and we actually had a walkthrough of exactly how this will actually pan out for the folks, and we did our the scheme of the drive up and where the walk-in people that are walking in, constituents that are walking in, can actually go to be seen. And so it looks like they're scheduled to be here on Friday, and we really hope that it's going to we'll have a good participation from the southern folks to come up and get themselves tested, especially if they have any kind of symptoms.
Mm-hmm. How many people are you anticipating to come out? I mean, because this is just for the constituents with the symptoms.
Right. And so, again, I was hoping that they would actually put it out a lot sooner, and this was something that I brought up to them because they said, Mayor, how many people are you anticipating? I said, well, we can't really give you a number if you don't really give us anything concrete, right?
Mm-hmm.
And I mean, if you're not announcing it to the public yet. And so they said, okay, we'll print out flyers, and we're just waiting for the flyers to come out. I know that I've seen a few of their postings that included Agate on it. So we're just doing our part. We're placing it on our Facebook pages, and any of our constituents that call in, we're letting them know that it is going to be on Friday from 1 p.m. to 4 p.m. at the Agate Senior Center.
Were you aware that it was going to happen on Friday before they announced it on Monday?
Just that call again. It was that inquiry call. It was the same conversation that we were having with Mayor Melissa, where she was just inquiring, and then the next day after I got off the air with you guys, we got a call from Linda requesting for. Actually, over the weekend, I received a call from her requesting that we have it down here on Friday. So that was my first call from Linda. I believe it was on a Sunday.
Are you anticipating a decent turnout, Mayor?
I sure hope so, because again, we're doing this for the people, and we're bringing it down close for those that are in the area, and we really hope that they come out, right? So everything, the focus has been up in Dededo and the central location. I believe Mangilao is having theirs on Thursday, and so having the opportunity to bring it down south, that I really hope that they come out. I mean, I'm hoping to get more than Dededo's first turnout at 56.
Yeah, let's make it a competitive thing. I mean, between you mayors.
The faster our constituents come out and get tested that, may have the symptoms, hopefully we can really find out really if we're on that curve or if we hit a flat line or really, what's our actual numbers. And so that's my main concern down here is that, again, even if it was in Santa Rita that came down and was tested, or even somebody from Umatic, these are our neighboring villages, and we frequent the same stores down here, whether it's Kimchi, Payless, or the 76 gas station. It's the same area that we all. Those are our common areas, and so I just really hope that everybody, and I really highly encourage anybody from even the other districts, to our neighboring parts of us, that they really come in and take advantage of this testing, because I'm not too sure if they'll have another one.
Right, and just for clarification for people that are listening, the testing in Agate on Friday is for all southern residents with COVID symptoms, to include in Narahan, Maritzo, Talafofo, Umatic, I believe Jotnia.
PD's on there too as well. PD?
Yeah, PD.
Right.
And so it's on Friday, and it will take place from 1 o'clock to 4 o'clock p.m. here at the Agate Senior Citizen Center.
So, Mayor, I'm sorry, Mayor, your colleagues, because this testing is being made available for all these different villages, are you kind of interacting with your colleagues, like Mayor Adlig of PD or any of the other villages that are also covered under this testing?
Well, now that everything's confirmed, I've instructed the staff to, please make sure that we reach out to each of the offices, and whatever is sent to us, be sure we send it to them. Again, we're still waiting for any of the flyers that are going to come out, and we only saw just what was sent on WhatsApp. I think it was circulated, and then it was sent to me by one of the constituents. So, again, we're just asking to please get our information first, so that way we can place it out to, and give it to the people, the constituents first, instead of having it secondhand, right? And that was on our conversation before, and so at least we're getting moving, and at least the testing is being brought down here, and I'm glad that it's going to be done, and give our folks again from the southern side an opportunity to have a location to do this. And so at first it was supposed to have been just a drive up to the Senior Citizen Center, but now the Senior Citizen Center will be hosting the drive-up testing, and then if there's any walk-in constituents that would like to be tested, it's down by the gym area, by the right across the church.
Do you have a lot of homebound individuals in Agate? Have they said what they were going to do, if they were going to go to their homes? If they wanted to be tested?
That was not an option that was given to us. It was just really for the walkthrough. I mean, during the walkthrough, they only discussed the walk-in and the drive-up.
We'll ask Linda. She's coming on in a few minutes, so we'll ask her that for you.
Okay.
Yep. So again, we encourage everybody to please come out. Again, you don't have to be from Agate. If you're from the southern side, please, come up to Agate, to the Senior Center, anywhere from 1 p.m. to 4 p.m. to, get tested, most especially if you have any symptoms. I'm also encouraging those, that are on the front line to, get tested too as well, and just to be safe, right? So hopefully they don't turn away anybody. I saw that they didn't turn anyone away yesterday that wanted to be tested.
Right.
Hopefully that's the case when they come down here to Agate.
Hope so, Mayor.
Do you have any COVID patients that are still in isolation in Agate? And have you spoken with them how they're doing?
Again, because they won't release any of the information to us other than, what the number count was. We did have a few from, that were just told to stay home, and that was basically, I believe from what we heard from the bingo that were attending the bingo, but those have since cleared. That was a while ago.
Okay.
And none of our numbers have really gone up. We had the 3 that were confirmed, and 2 were already removed from that number, and so we had 1 left, and the dashboard, I think, was still showing that there was still 1, so I'm not too sure if that's been updated since.
Okay. Well, is there anything else you wanted to get out to the community about the testing scheduled for this Friday?
No, but I do want to say again, thank you to thanks for of course always including me in your morning conversations with the people and allowing us to actually put it forth, right, and put the information forward for them, for your followers to listen and to hear what is going on in the municipality of Agate. And again, on behalf of myself, of the staff, and the Vice Mayor, we want to make sure that everyone, please, even if you're not from Agate, please, you're more than welcome to come in and get tested here in our municipality.
Well, thank you, Mayor.
Friday.
We like to think of ourselves as your bullhorn, okay?
Thank you so much.
Right
You guys
on.
have a great day.
I didn't want to use my wand today, Mayor, but you left me no choice when you told me that you were the last to get the WhatsApp flyer, and I'm going to use the LG 2020 model on this. Alakazam, Alakafro, please keep our island mayors in the know.
See what I got to deal with?
You know you like it. Okay, Mayor.
Thank you so much.
Hey, by the way, Mayor, thank you so much for the mangoes. If any more
Yes.
falls down on there, you know
I
where
will.
we're at. Yeah.
We will.
Okay, thank you,
Take
Mayor.
care.
Okay.
Wash your hands. Okay. Steph.
Bye.
7:04. Let's go over to Tay here. Tay, good morning.
Hi, good morning.
Hi, Tay.
Thanks for listening. You had a question about the testing, right?
I did because that's sad that our mayor was asked to know. I'm from Agate, and I do know an individual who didn't get tested due to the fact there is someone in their household that had the COVID-19.
Wait,
and they just quarantined.
was this recent?
Yeah, this is recent. They just quarantined themselves, and none of them, thankfully, none of them in the household, aside from the individual, had the symptoms due to being one of those individuals who are elders and having the diabetes and all that nonsense. Because to me, the way I see this virus, it's like having a cold. I mean, a seriously bad flu cold that no one wants to take serious. And, just like any common cold, you have to be away from other people so no one catches it, right?
Mm-hmm.
So the others who stayed in the house were just told to quarantine. They never got tested, regardless if they had no symptoms.
When was this, Tay?
Yeah.
This was just what day is today?
Today it's Wednesday, April 29th.
The 8th of, let's say the 8th of April.
Okay.
The 8th of April, the individual went in, so the 9th they found out. The 22nd would have been the quarantine for the 14 days. So they did get cleared. They were told by public health they're not going to get tested. I guess unless they have symptoms. Obviously, I guess we don't have a lot of testings or whatever.
Right.
But I just want to know, anyone can go there and they won't turn anyone away. Because I really want this family member, regardless if they're already cleared, to get tested, nonetheless, still.
Right. You know what?
They were cleared by public health?
They were, I don't recall exactly how they got cleared by public health. I know something that they had to go somewhere after the 14 days and then get cleared after the 14 days. But public health did call them every day. That's what they said. Because I wouldn't allow anyone to go there.
Mm-hmm.
If they needed anything, I would be the one to go there and drop it off out their house.
Mm-hmm.
I wouldn't allow anyone to see them, touch them, whatever. I don't care. Because I have an infant, and I didn't want him to get sick.
Right.
So,
You know what I think is interesting, Tay, about this testing is, the biggest spreaders apparently of COVID-19 are those who are asymptomatic. So if we're only testing people with the symptoms, I mean, you know what? We're going to ask Linda.
Yeah. And I would think that if you've had contact with somebody,
That should
you
be a
would
criteria.
Yeah.
yeah, well, I'm an essential worker. I have contact every day as I work, and I take precautions for both families, and because I'm the one that stays out being an essential worker, I'm the one that gave that option to give it to that, help that family, because I don't want them out and I don't want any of the family member going to them. But I just wanted to find out, because I just heard, I just tuned in. I'm on the road, just tuned into your channel.
Thank you.
Mostly because you guys give up a lot of news than me reading it, because I cannot have time reading it. So I wanted to make sure that anyone can go and not get turned away, even though they got recently cleared. Even though they got cleared, can they still get tested? Because they never got tested.
Right, or you could just follow Mayor Savares' advice and just go to the community testing and say that you've lost your sense of taste or smell.
Yeah.
That's something they can't. I mean, we're really trying to dupe the public health system just to get tested. It's crazy, but it's the reality.
Mm-hmm.
Well, I'm going to let them know. I hope so, because,
And we're going to have Linda on today, so we can ask her.
But I'm thinking the time that you said, I don't know if you had contact with a COVID-19 positive patient was one of the criteria, because we were running under a different criteria for testing, right? And now they're widening it because we want to test as many people as possible. So, Tay, we'll ask Linda that for you, okay?
Okay.
Okay, watch the road.
Be safe.
Okay.
Wash your hands.
Thanks for working.
Hagamos.
Yeah.
All right.
Okay.
Okay, bye. Bye.
7:10, Guam's favorite. We'll take a little break and we'll get some people on the phone here. It's the K-Wave News Takeover. Jay, what do you got? You got some comments or something?
Oh, okay.
Every time you get up, it's like.
Oh, I guess I was just putting my wireless keyboard down, but no. Okay, so further to again on what they were talking about, Bree, because you made a very, very good point, and a lot of people gave it the thumbs up when you said our priority is and should be health and human life, and then the economy. Somebody was saying they actually want to shoehorn in before the economy. Churches should open, because they were like, is there anything more valuable after your own well-being than spirituality? And so some people are saying, yeah, they're really in favor of the churches opening before the commercial interest and everything like that. But, even that's a really delicate issue, because
it's not so delicate. I mean,
it literally is a congregation.
Yeah, I know. Of course it is. But you limit the number of people who can go, and then the rest of you guys go on to KUM News Facebook, and we social distance.
Yeah, but of course, the Archdiocese did give us that.
Hey, if it's between arguing to open the malls and open the church, I want to be on the church side.
No, but the Archdiocese did give us that release. A week or last week, that they were saying, the church is going through some very, very difficult times now because they can't rely on the donations and the tithing and the devotional. So they're asking, and a church by its nature relies on the parishioners to clean it, to spruce it up, to do the electrical work and everything like that. And they basically can't do that right now.
Yeah.
And so they're asking people, if you want to mail in a check, if you want to do PayPal. I know the Archdiocese with the Cathedral Basilica itself, they have, I believe, they've got at least one PayPal account that you can make your tithes to.
And that's the thing, though. People just don't have any money.
Yeah.
So it's difficult all the way around.
Yeah, and we're just speculating from our vantage point as the media. Gov Guam right now is looking at all of these different things and all of these inputs, saying, okay, what can open and in what order and to what degree, and that is a mammoth, colossal challenge right now. So
right. I don't want to just say it's just Gov Guam. I think you should add in the business community.
Right.
So, and then hopefully Gov Guam is taking their thoughts and their input seriously.
Yeah, and Debbie Davis, our friend from Bardstown, Kentucky. So Debbie, we appreciate your input. And she was even saying, the thing about the haircuts. And she said in Kentucky, they're talking about that a lot, because I don't believe that at this point in the whole pandemic era, it's been actually definitively stated that, haircuts are a safe thing. I know some people whose friends are they work in dentistry.
Yeah.
And dentists are like, we're gonna stay closed for a while unless it is an absolute emergency.
Mm-hmm. And people are also like going to the doctors, and this is what the physicians advisory group and other physicians have been saying, that to continue going to your medical appointments, but there are some people that are like, I don't want to go, I don't feel comfortable.
Yeah.
But you really should, because it's going to come to a point where you're going to get so sick that you might reach this point of no return.
Yeah, that's a real concern with the Physicians Advisory Group. And in fact, also meeting with, the COVID-19 response and the testing and all the other public health stuff with COVID, there's also a really big conversation, exactly what you're talking about. People with diabetes, heart condition, lung conditions, chronic illnesses. These people probably haven't been doing the self-maintenance that they should be. 7:14, let's go to the phones where we have the Director of Public Health and Social Services, Linda Pinko Denarcy. Good morning, Linda.
Hi, Linda.
Good morning.
Thanks for taking some time. We know you're extremely busy. Jeez.
So, Linda, it kind of looks like you guys got some higher numbers yesterday at the community testing. 86 people showed up. What'd you do different than Saturday, or was it just that maybe people knew about it longer?
Yeah, it's a combination of both. We had a whole schedule that was listing all the different dates that we're going to be doing this outreach, and so people will have a selection of what's convenient most for them. So I think that helped a bit. As you know, we had the outreach earlier, which was Saturday, and we had 52 tested, and of that amount, 47 were negative, and one was a follow-up, 3 were repeats, and 1 was invalid. And then our staff, what we did also differently was we wanted to be closer to the area where they go in and they're cleared, so that will save a lot of time. And of course, as far as advertising for this outreach, the mayors did a great job. We passed out the flyers to all the mayors in every single village, and we did everything electronically as well, and our staff have been out there, continually advertising about the education and the importance of getting tested. So I think that helped a great deal.
Right. I know when you guys had the press conference and you made the announcement on Monday, I think every single person in the media was like, get those graphics ready, put it out, put it on social media.
We're like your ad agency, Linda. We're working hard. You just got to give us the info a little bit earlier, and we pump something out nice.
No, we work fast. So,
yeah.
We're trying to get all this thing done, and it's not just up till today. Today we're excited because now we're going to take the entire island. Again, it's going to be at Stumbo. We're just trying to finish up at the north, and that's going to be at 3 to 6 p.m. So I hope you can also help us to advertise that.
Of course.
And then Thursday, which is tomorrow, we're gonna move now to the central region of the island, and that's going to be from 3 to 6 p.m. and it's going to be at the Manilo Senior Center, right adjacent in line with the Manilo Night Market, and where Santa Teresita Church is. That's the area. And that's open to any central residents of Agana Heights, Aspen, Mahina, Barragata, Chalampago, Orda, Agana, and Manila, Momonto, Tumaiti, Sinahanya, Tumaning, and Tumon. And then finally, Friday, May 1st, we're going to Agate Senior Center. And adjacent to that, we're going to use both areas. DYA has a youth center, and that's going to be from 1 to 4 p.m. This one is going to be open to all residents of the Southern. As you know already, Icat, Inalahan, Marizo, PD, Santa Rita, Talofofo, Umatic, and Jonya. And then on Saturday, we keep our staff very busy. We're going to do outreach, and we're going to actually do all the swapping in the areas where they're congregate high-risk homes. And then we're also reaching out to the homeless population in Agatna. And, through our journey the following week, we're going to continue on, and we're looking at other areas like we're focusing on Hemlani area, that whole region where we're going to go into Harmon, Tumuning, Marizo, and Maiti. And very vulnerable population, as you know, is our elderly. So we're going to be also looking at the Gumat Tranquilidad housing area. And, of course, St. Dominic's. We've been in communication already with St. Dominic's, and everyone is very, very excited. We would like to focus on the mononcles. As you know, this virus really takes its toll and hit on those that are over 60-some years old. So we want to make sure they're well protected.
Okay. Well, hopefully we can get a calendar out for you and help spread the word once you finalize all of that. I did want to follow up on something, though. We talked about a week ago regarding the homebound, the people with disabilities that can't make it to the testing sites.
Yes. We will, Sabrina, we have staff that actually go out into the field, so it's not like they just come in and walk in and drive through. If we get any suspicion of anyone connected by household or contacts, or even they call our hotline, right? We can get their name, their contact information, and our staff will go out in the field and we will do the swap. And that's what we're planning to do on this coming Saturday. We're going to start off going into these continuous congregate homes, housing, as I mentioned earlier. But you didn't ask me how the test result was yesterday. It was 86 tested. That was really good.
Yeah, no, that's where we started.
We said it.
Yeah, Linda, good job. What kind of numbers and how many test kits are you bringing with you today?
Okay, today we already have our nasopharyngeal swab in our virtual transport medium. We have 200, but I have a 200 backup, and not to worry, because if I need more, I have more backup.
Bring it, guys. Come on and get tested. We got backup.
We want to get this thing done because, again, the data, we reported all to the governor, and she and Dr. Mike Cruz really are monitoring everything. I know they're really wanting to go into recovery, and I know everyone's anxious and excited, but if we don't do what we need to do, we don't want to move too quickly now, because we don't want a second wave, and that's what we're trying to do. We're trying to reach out to these pocket areas of infection so that we're able to see what is out there that we probably have not reached, or they can't come into our facilities, whether it's the hospitals or the community health centers or any of the private clinics.
Linda, so just to really just clear it up, people who show up at the community testing today, they don't need to bring any money. It's absolutely 1,000% free.
Of course. It is absolutely free. They do not have to pay a penny. Yes.
And then also, we had got a call from a listener a little while ago, and she had told us about a positive case, and I guess the individual was self-isolating in the home, and the rest of the family were not tested. And I'm just thinking at that time, was that one of the criteria if you had come into contact with a COVID positive? And and then today, if this was to happen today, would that family be tested under the new criteria?
Yeah. Well, when they are tested and there's a positive, what we want to assess is other people in the home front, right? And also the conditions in the home. For example, if there are other people that live there that may be elderly or they may have comorbid conditions, we're also concerned because the individual that lives there may spread it and of course, be in close contact with these people that are living there, and they might be contaminated and of course end up having with the virus. If we also, not only that, we also look at if they're in the home front, do they have their own bathroom, or can they really be isolated, separated from these individuals that live with them? They have their own bedroom, and again, if that conditions are met, then we can have them home isolated, if not, then we will move them out and tell them we can put you at one of our government of Guam isolation facilities, and then they can be there and be closely monitored. We have our nurses there, and they will check them twice a day, and anytime they call, whatever needs they have at the isolation facility.
So was that a yes, Linda? They would be tested today, and should they have been tested back then?
That's another part of our movement forward. If they are living and they tested positive, sometimes the person could be asymptomatic, and our plan is later on is if they are closely together and the chances are that they may be exerting symptoms, of course, we'll test them right away.
I had a comment here on our Facebook. I went to get tested from Jess at a Stumbo gym yesterday. When do we hear back the results? I saw the latest count, and I said only one tested positive. Is there a
Yes.
number to call to check? I haven't heard back from anyone yet.
Yes. Normally, when we do the testing, the results came out really, really, really late at night.
Right.
It was like about, I would say, close to 10:30 because
Mhm.
I was waiting for the results. Normally, the testing, we at Public Health in the lab don't tell you what the results are. We tell, we go through the providers. Normally, in this particular case, they will be notified, and I believe that we'll make certain that their provider notifies them. And in this particular case, because it's a walk-in, I'm going to make certain that this information is filtered throughout the community health centers. They will be notified. There's only one positive, so and if again, because they probably haven't been notified yet. It's a link that we identified in a previous cluster.
Oh,
So
can
if
you
they
give us
feel
more
that
info
they're
on
linked to a
that,
previous
Linda?
cluster-
Which cluster
yeah,
was it?
that was a link with the Iglesia Ni Cristo Church.
I see.
Yeah, so if they feel they didn't go to the Iglesia Ni Cristo Church, then I think they're one of the 85 negatives.
Okay.
Okay, is that good enough?
Yeah. So, hey, Iglesia de Cristo, let's go get tested. By the way.
I really encourage all of them to come in,
Right.
seriously, because if you don't know and you're just thinking, oh, I might be, I might not be, I'm scared, the only way to alleviate those fears is to be tested. And then we will guide you through so that your fear is minimized, and we'll give you all the education. We will do all we can to get you to recovery. As you know, we are now at 130 that have recovered as of
Wow.
April 28th.
Yeah,
Did you know
Linda,
that?
we played that video from the 92-year-old recovery
Yeah.
patient. That
Really
was pretty
nice.
cool. Good job there.
No, it wasn't that beautiful. More coming out, and they really want to tell their story.
92 years old. Wow.
I know, she looks so young, doesn't she?
Mm-hmm.
Yep, she's drinking her bija juice. Sorry.
Hey, I wanted to follow up on a phone call we had yesterday because everybody's talking about, is it free or is it not free, and there was
It's free.
even if you have health insurance though, even if you have health insurance, you go to the clinic.
Yes.
Okay.
Yeah.
Okay. So yeah, this guy was turned away. He
No,
went
no,
yesterday.
That's probably because he's asymptomatic.
Okay. Okay.
But you know what?
Can we just tell people to just say you lost your like Mayor Savares did, say you lost your sense of taste, sense of smell?
Chris, we're planning. Just tell them to come and just bring them down there, and we're gonna test. Okay.
Okay. Yeah. So the guy
so that shouldn't be a barrier.
Okay. All right.
All right.
So I think his name was Ed.
Ed
You heard it? He
Quintanilla,
said it was free.
comorbidities. Yeah.
Yeah.
Got diabetes.
Yeah,
Goes to
yeah,
dialysis.
yeah.
Linda, I don't know if you got my email already, but we just have to ask you, there was a report that came out about the governor's chief of staff, Tony Babauta, staying in a suite at Pacific Star, and I sent all the FOIA requests this morning, but I know that Pacific Star billed your department for the quarantine there at the hotel, so is there anything you can tell us about the accuracy of that information?
The accuracy of that information, I just wanted to let you know that I believe he just spoke with me the other day. He wasn't feeling too well, so he wanted to make sure that he didn't want to affect any of his family. He does have elderly parents, so he wanted to make sure that he was not in close contact with people that is very dear to him. So I believe that's what happened.
So he's just basically self-isolating at Pacific Star?
Pretty much, that's what he told me.
Did he say that he was feeling symptoms or something, and has he been
yeah,
tested?
he wasn't feeling too well. That's what he told me yesterday.
Does he know there's free community testing out here?
I believe that everybody in the community should know because, of course, we're launching this whole testing to everyone. So I'm not going to single out anyone. I just hope that everybody is, reaching out to all these opportunities that we have that we're trying to move forward in our quest to recovery.
But Linda, if I called you guys and said, hey, I don't really feel good, I got some family members, would I be able to check into the Pacific Star without a test?
Of course, we will monitor you, and we will get your information, and our team will come and we'll contact you, do our assessment.
Okay. And you said you found out yesterday, you spoke with him, that he wasn't feeling well.
Yeah.
Right?
just
How long was he
yesterday.
staying though at the
Oh, I
Berkshire?
don't know that information. We didn't get into details with that. I was too busy hurrying up to get other things that were very vital to be done, such as informing about other things that are related to the government. We always get
Yeah.
the count.
I know you're busy. You're not. You're too big. You're not
Yeah.
a concierge. So what?
Yeah,
What was? What
last
is?
night with testing that had to be done
Yeah.
in the evening, so my nurses were on standby waiting, and so that's why I really had to get a lot of work done yesterday.
Right. Yeah. I feel you. So Linda, is he staying in a suite?
I have no idea. You know what? I don't go into the details with that, and I'm being very honest with you because
I
I
know.
really didn't go into the details. You know, I always give you the factual information.
I know you
so-
do.
Yeah, so
Okay.
please understand that
No,
I'm
we
just
understand.
giving you the information that I know.
No,
okay?
Linda. I mean, we asked you about the Gita director, and you told us point blank. So yeah, I mean, if the people I see, the people I want to ask, and I know I'm going to get a straight answer, at least what they know. I feel like you're one of them.
Oh, thank you, sir. I appreciate that.
Okay.
And I know I'm going to be in another interview with Patty Arroyos at certain time. So
So at
I'm
least you got to practice your answer a little bit.
you and Sabrina always give me the tough questions too.
Ah.
You know? But I really appreciate it, and I want to just thank everyone in the media. You guys have been doing a superb job as far as giving the information out to the community, and I can't thank you enough for all that you have done to help our island as well. So it's very important that we give out factual information and we continue to keep them posted and let them know that these outreaches are there to help them. And, we don't want you to feel like you're all alone. We want you to know that our staff will also go out and find you in your home. That's what we're going to do in the next series is go into the homes and swap them right on the spot.
Wow.
Is that like next week?
No, this Saturday we're going to begin.
Oh, the congregate homes. Okay,
Right,
yeah.
right,
Yeah,
okay.
congregate homes,
Mhm.
apartment units.
Hey, Linda, let me ask you. So after we do this round of community testing this week, are we then going to do another round in a couple weeks, or how's that schedule going to go?
Yeah, okay, that's a very good question because right now, we're going to see how the results are. Our goal is to move forward, as I told you, going to these congregate homes and the senior citizen, St. Dominic's, and also the Guma Tranquilidad and these homeless, and the homeless individuals, right? What our next step, and I'll tell you right now, is we want to go to the frontline workers. We want to go to those that may have been exposed via they're transporting individuals like the fire department and also the police because they pull people over, they're in contact with people. And then we also going to focus on the healthcare workers, all the people that are working in like the hospital and of course public health, the nurses and the surveillance team that go out there, and actually all our staff that do the swabs. They're in isolation quarantine facilities. We're gonna go to all of them, and of course the behavioral health that deal with patients that are nurses there too. We're gonna start with that, and I think the governor should have a feedback from the department as far as our confidence. We're not going to let our guards down. We're going to continue. If we move forward, we're still going to beef up our isolation and quarantine enhancement. In other words, we're going to enhance it because if we continue efforts, we want to make sure that anyone that arrives on Guam continue to be isolated or quarantine, and then become isolated if they experience symptoms or they're positive for COVID. So these are things that we want to make certain that are still in place, and hopefully down the road we want to keep that permanent within our department to have a unit for that specifically. And as we journey towards elimination and recovery, these are the things that we're planning to do at this time. Does that answer your question?
Yes, it does, Linda. Very
but
thoroughly.
I have one question. Nice.
Yes, Sabrina.
Okay, so the governor, she said, I think it was last week, that as they work on the economic recovery plan, it is a plan that has to be approved by the Department of Public Health. Correct?
Yes.
So what
That
is
is, well, not only us, but she also has her advisory council, and she also are physicians, and she also has her recovery committee our task force that is built in. So I think it's off
but she's
every-
also said that the Department of Public Health is in charge of our COVID response. You guys are like the end all be all, I guess, when it comes to COVID recovery. And having said that, what are the what has to be checked off for you to say this is good to go? This recovery
When
plan.
we see that all these pocket areas of infection, there's very few, as you can see, and that we're seeing lots of negative results, and people are in good condition, that they don't exhibit any symptoms. And again, we'll get that all verified and clarified with our CDC advisors that are here on Guam, especially our epidemiologist, Dr. Thane Hancock. We're all going to be coming together as a team. When we see lots of negatives and people not being sick, I think that would be a great sign, especially in these pocket areas of infection that we probably were not aware of these individuals. That's what we're aiming for, because they couldn't come into the hospital or at our community health centers or at the private clinics. So that would be our sign. Data will drive this and let us know, and that's what we're aiming for. And that's why we're working as fast as we can.
Right.
All right.
And I know that you guys also have the Division of Environmental Health. You have your public health inspectors.
Yes.
And if they decide to reopen
Yes.
restaurants, I mean, I'm sure that you probably have requirements that have to be in place
Yes.
before
Right.
you would make
One
a
of the
decision.
requirements- Yes, one of the requirements we're thinking is, we're going to scale down on the percentage of people that are dining in, and then of course practicing social distancing in the restaurant. So that's going to be always in place, and then as we journey through, we're gonna do it slowly. We're not going to be very rapid, and again, the occupancy of these restaurants will be at a lesser percentage.
Linda, let me just ask you, because this is something I was thinking about. When you open the restaurant, we do dine in. I take someone out to dinner, the kids out to dinner or whatever. Who's wearing the masks at the dinner table? Is it going to be the servers? Is it going to be the customers? Do we wear the mask and then move it to eat? Or how's that going to work?
Yeah, those details, as far as everybody should be wearing masks up to this day, whether you're dining in or not.
Right.
In my opinion, even
Yeah.
the cook.
I
So
see,
that's
I
what
see.
I want to keep in place. I don't want to be too lax at this
Yeah.
point. So
Yeah. No, good.
let's take it one step at a time. And then as we journey through, we'll have some more guidelines that we'll put out to the community in our memos, and that will be very clarified for
Thank you.
everyone in the
Yeah,
community.
send it over so we can
Send
get
it
the
over.
PSAs
we
out.
Gotta, we got to work on our graphics, Linda. Send it.
Okay.
Okay.
Thank you so much.
Thank you, Linda,
Okay,
so
good
much.
luck
Appreciate
today.
it.
Okay.
And
Thank
wash your
you.
hands. Wash your hands.
Thank you too. Bye-bye.
Okay, bye, Linda. Well, there you go, Linda Pinko, DeNorcy, 735. She seems reinvigorated, right?
Yeah.
I mean, they want to get out there and get this testing done, and obviously it's a big part of whether or not we're going to reopen non-essential businesses.
Yeah, I
Well,
mean,
she
she's
actually-
got so much on her plate.
Wow,
because
yeah.
public health, when you think about it,
Why would you
they-
name Iglesia de Cristo a COVID hero, but not Linda Pinko DeNorcy?
Yeah, and all her staff. I mean, her staff were incredible.
Yes, Jason, good morning.
Okay, and people are noting in the chat room that they are very much supportive. They said they're praying for Linda and all of her efforts, but like you very pointedly said, Bree, it's Department of Public Health and Social Services.
Right.
So there is a lot that wonderful woman
Right,
is
public
responsible
assistance.
for
Right,
and her team.
yeah.
Division of Environmental Health, senior citizens.
Okay, it was also brought up again, people going back to the mall thing, right? When businesses, non-critical businesses start to open, people were saying, how will employees of those businesses, they would hope it would be mandatory for them to be tested. So like if you're going in, you may have a cashier, you may have, like Chris said, you may have, a waiter or a server
Temperature checks probably.
Yeah.
Before you go
I mean,
in.
how will the employees and how often will they have to
It's
be
just
tested?
funny to me that, thinking about how this is just going to change everything. Like, we haven't even got there yet.
I know.
But dining in a restaurant, you take someone out on a date and you're both wearing masks. And
Well,
you
I don't
gotta-
have to worry about that.
You got to you got to sit 6 feet apart. It's just
but-
kind of like
But
You're gonna kiss your date goodnight.
people are going to be Magundai after this moment.
No, I'm still wondering seriously, because I'm one of those people, like when I go to public places and everything like that.
When
if
you
I
go
have-
out on a date?
No, definitely not. I mean, if I have to wash my hands, if I have to answer the call of nature, let's say, I'm really curious about what that's going to mean for public restrooms, because not all of those places are patrolled by private security or things like that. So
Just don't go. Just go home.
you can put a sign on the door that says social distance in the bathroom, but
What?
no,
One at a time.
No, that's what I mean. but
One at a time.
How do you,
Alright,
how do you
Public
police
restroom.
that?
Just go back to your
Yeah, you really want to know.
I
You
tell
should have
you-
asked Linda. She was on the
Yeah,
phone.
you got to get you some headphones so you could hear
I mean,
Linda.
easy. One at a time. That's it. Boom.
All
Done.
right, Dave. No, my boy had his coffee this morning. That's why he's extra feisty. Hey, we're take a break. We'll come back with Dr. Felix Cabrera from the Governor's Physicians Advisory Group. Right here on the KUAM News Takeover, Guam's favorite. It is containing COVID. Good morning.
Be healthy. Be informed with ITD.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc. Be healthy. Be informed with ITD.
Self-storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Hafade Guam, Adriana Cotero here, and I am currently reporting from home. And I encourage every single person in this community to stay home. COVID-19 cannot survive if we do not feed it, and that means staying home and washing our hands. Now, I know I've heard people my age in their mid-20s say, it's okay, we're young, we're healthy, we have strong immune systems, we could fight it. That's not true, and we also don't know who we could potentially be exposing. The only way that we can fight it is if we stay home. It is our duty to stop the spread and to stay home. Be safe, Guam.
Self-storage, conveniently located near the Harmon McDonald's, offers fully covered loading and unloading area with individual pin-coded gate and door access. Call us today at 648-7867 for more information.
Specialist Joshua Mancinopia. I can't wait for him to come home. Keep us safe and stay home. I miss my daddy, and I can't wait to see him. So keep us safe and stay home.
Good morning. That's feedback.
From what?
When you put your headphones that are on the
Oh, I'm
volume.
sorry.
Yeah, that's all. Hey, appreciate your feedback. Hey, that's an old-time radio joke right there.
Hey.
7:43, KUM News Takeover containing COVID. Let's get the governor's physicians. Let me start over.
Hello.
Dr. Felix Cabrera from the Governor's Physicians Advisory Group. Good morning, Doc.
Good morning, Chris. Good morning, Sabrina.
Good morning.
So I know you guys had a meeting last night with the PAG. What can you tell us about the conversation that happened last night, Dr. Cabrera?
Yeah, sure. You know, we typically have a conversation about a variety of topics. Overall, it was, we had FEMA present, and it was just nothing really specific on the agenda with FEMA. It was just more of a general discussion about understanding the status for each side and ensuring that we have open communications with them. Then there was also discussions, of course, about the reopening plans and reviewing the gated process and the criteria that goes with that, which is still very much in discussion, but pretty much, is pretty close to getting finalized. And so that was heavy on the topics.
What can you tell us a little bit more about the criteria and the triggers that are going to be used to determine what we reopen and how many we reopen?
Sure. I don't want to go into too much detail about the overall opening, because then that's going to be, of course, up to the governor, and then also Ricky Hernandez, who's the deputy director for GIDA, who's been working very hard on this whole proposal, and it's very comprehensive and it's really impressive. But it takes a lot of pieces from different states, and including the White House's opening up America Again plan, and really tailoring it to Guam, and so it's pretty thorough and impressive. But the main parts of it in terms of what is the key criteria is, we're going to be looking, of course, at the cases of COVID-19, and that it has to be, of course, a downward trend, and that we're really looking over a 14-day period, and right now it looks like we're very much meeting that criteria.
Right. So, Doc, let me just interrupt and ask you, if we went back 14 days, the plan was out, would we have some reopening just based on today and back 14 days?
Again, the cases being only one of 4 major criteria, but if you're talking specifically about the cases alone, I would say we would meet that criteria at this point in time.
Interesting.
Did you go over the 3 other criteria?
Did you go over the 3 other criteria, Doc?
No, you didn't even let me finish.
I'm sorry. Yeah. Go ahead, Doc. I'm going to mute myself, okay?
No.
Oh, yeah.
Clarification is always important.
Right, yeah. Go for it.
So with the case, it's not only the downward trend of the confirmed cases, but also a downward trend in what's called the test positivity rate, and that we're seeing that the amount of tests that come back positive from the amount that we do is at a low number, and that what that really just tells us that we're casting the net wide enough, and that we're testing enough people to try and catch as many as we can in terms of really understanding the case, what the true case prevalence is on the island. So those two in combination, if they're trending downward, then that reassures us that we really are in a stable position. So that's the cases part. The hospitalization part is the next one, number 2, and that's really basically, it is subjective in a lot of ways, but it's basically saying that the Guam hospitals are able to treat all inpatients without resorting to alternative standards of care that's due to COVID-19 cases. And so this also incorporates, the non-COVID surge that's occurring right now at GRMC, for example. And so it takes all those different parts into account, but in the end, it will be a recommendation from the CEOs of both hospitals to the governor, whether or not that meets, if that criteria is being met. And then number 3 would be testing overall, and that's Guam's capacity to test all people with COVID-19 symptoms, and the capacity to handle if there's another big cluster that pops up, and our ability to handle that. And then number 4 is the contact tracing by public health and their capacity to conduct adequate monitoring of all the COVID-19 cases and tracings of their contacts. I would say the last 2 are probably the 2 most important. of the 4, and that we have to be really sure that those 2 are met in order to move on to our next stages of reopening.
Okay, so check 1, check 2. Are we like a semi-check on checks 3 and 4?
Yeah, so I would say that the one that's probably still a little bit most up in the air is testing. And what I mean by that is that, yes, we're doing a lot more testing. We've had the capacity to do much more in terms of all of different labs having increased ability. Also, that dependent on the availability of test kits, swabs and reagents and the like. So, but what's even more encouraging is what we expect coming in over the next several days to even next week. And so, based on that, we're on a really good trend that we will meet this criteria very shortly. Is what we expect. And out of the 4 main criteria, that would be probably the one that's probably the bottleneck right now.
Okay.
What can you tell us about the conversation, if you know it all, between the business interests and economic recovery side and the public health side with, for example, Dr. Mike Cruz, who's on the recovery panel of advisors. What's the discussion like in terms of reopening the island? Is it pretty heated, or people firm? Is there any compromise? What can you tell us about that, Doc?
From my understanding, and again, I'm not fully involved in all that very specific detail, but the reports that I've gotten is that it's extremely cooperative, and I think the business community, they're very much very understanding of what the criteria is, and that it's mainly based on medical data and our understanding from a public health standpoint, and that the business side is more in terms of how they're going to carry out the reopening itself, and with the guidance that public health will have in recommending the different steps and criteria to reopen. And because the reality is that none of this is going to be a light switch, and this is a dimmer that we're going to slowly raise up, and if it gets too bright too quickly, then we're gonna we can always back off a little bit. But that's why these checks and balances and tripwires are all in place, so that we keep also measuring well. Once we make we take a new step, that we're vigilant in monitoring what happens after we take that step, and then understand if things were moving too fast, or maybe not fast enough, or that we can actually go a little bit faster. So it's really unclear at this point, but they're very much understanding that. I think initially they were very much focused on dates. What date are we going to open? What date is this going to happen? What date is not going to happen? And what we all have to really understand, and what it sounds like is the business community is really understanding this much better now, is that we are on virus time. We are not on human time. And what I mean by that is that the virus and how it's and what it tells us and its own timeline is going to dictate when we meet these different criteria, and of course with our efforts. So to give a specific date is we may not meet certain criteria by a specific date. So let's just say when we meet these criteria, then we'll have a good idea of then when things will happen. Not that we say in 2 weeks we have to meet all these 4 criteria. That doesn't work that way. It'll be like, oh, looks like we're probably checked all 4, so let's look at preparing to open in within or start the next steps within 24, 48 hours. I'm not sure what that's just a guess on my side.
But Doc, what happens if we do the partial incremental reopening and then we get positive cases associated with that reopening?
Yeah. So there is going to be a tolerance for some positive cases, because we have to understand the reality that exterminating SARS-CoV-2 from the island is probably not a realistic possibility right now, and that we shouldn't plan that we're going to do that we have to have achievable goals here, and part of that is reopening, because our current state is just not going to be sustainable in terms of how strongly we are we're in this lockdown, so to speak, and we have to allow ourselves a buffer room. So there are going to be some cases that are going to pop up. Basically, what we've been seeing over the past week or so, one last night, 3 the day before, 0 the day before that, 2, and so we're trying to figure out what that true number is that we're allowed to go ahead and say that we can be up and down in this basement, so to speak, and we think that number might be 5. Basically, five new cases per day.
Per day, okay.
Yeah, we think don't hold us to that.
Right.
We're thinking that right now is might be the good basement number, and the reason why that number might be good is it's basically 25% of what our worst day was. If you look back over the past 6 weeks,
right,
and so we had 19 in that one day, and so if we say we make 5 a nice round number, then as long as we stay below that and we don't start trending way above 5, then I think we're going to be okay, and that this epidemic will definitely be considered controlled.
Doc, just from a purely medical standpoint, doctor's orders, doctor's advice point of view, do doctors believe that continuing this lockdown and not reopening businesses is the most effective way to kill the curve?
I think if you're saying that to just remain in the exact same state.
Yeah, let's just say that let's just say Chamber of Commerce, Gita wasn't involved in this, and it was just the doctors from a public health medical standpoint calling the shots. Would the doctors recommend to the patients, the people of Guam, that we just need to stay locked down, we need to keep doing exactly what we're doing until we kill that curve?
Yeah, so here's the true doctor answer, and that's that everything we say and do in terms of what we recommend is based on risk and benefit. And so there is risk of staying in this lockdown as well, right? And that's the risk that we have to other non-COVID diseases and chronic diseases that exacerbate. And so there's parts of that we have a lot of concern about as well. So I don't think that would be our overall recommendation, because unless there's a vaccine that we know is just coming and we're waiting for it to come, then maybe that might be the case, that we just that we hold off for if it's going to come in the next few weeks or a month. But the reality is, until that happens, which may not be until a year from now, if it ever does happen, right, that we can't, that this way of life may not be sustainable, at least at this point in time. And again, it goes back to that nobody expects this to be a light switch that's turned on. And that,
well, you have a gift with metaphors, Doctor. I think that's a good one. It's not a light switch; it's a dimmer that we slowly illuminate, and then things get crazy. You're back in the dark.
Yep, exactly. Yeah, and then bust out your candles, and we'll stick with that for now.
I wanted to follow up on did you? No. Okay. You guys are talking about this reopening of the island. I wanted to know whatever is in place, who's going to, and whether it's restaurants opening and there's social distancing that has to be implemented. Who's going to enforce all of this to ensure that businesses, whatever the rules are actually sticking to them? And will there be repercussions? I mean, is this part of the discussions?
Yes, absolutely, and that's a big part of the discussion last night, in fact. Mm-hmm. And so, the on paper, public health will have a big role in terms of the policing of the enforcement, the police themselves, maybe, and the like. But the reality is that who's going to be the true person that's going to be policing the businesses? It's crowdsourcing. It's the whole entire public. And they're the ones that are going to probably keep businesses in check and ensure that they're abiding by these. Because if they're not, then they should not patronize these businesses, and then it becomes and then the effects of competition comes into play, and that if a business wants to do well, they're going to have to adhere to this, and that's pretty similar to in terms of health, sanitation and health in terms of these restaurants, right? If there's a cockroach, the community is going to let a person's going to let the public know through social media that they found a cockroach in this restaurant's food, and so there's a component of that as well, and we have to understand that there's a lot of power behind that, but there still has to be an organized part of it, and that's of course going to be, I think, through public health, but I think that is actually truly to be determined. And I won't, speak for Linda and in terms of what her take on that would be overall. But if it's anything like standard food inspection, things like that, it would be probably similar.
Mm-hmm. You mentioned earlier about this non-COVID surge. Did you say it was at GRMC?
Yeah, and so it's primarily been at GRMC in terms of our significantly high census, and so part of that has been a result of a lot of different factors, including the decompression of GMH in terms of preparing for what could have been a massive COVID surge to GMH by itself. But in that process, GRMC has had to take on a lot of the typically ill adult patients that require inpatient service. And what's been tough is that a lot of this has been you could reasonably argue that it's been related to patients not getting a fair amount of them not getting enough adequate primary care and preventative care measures to prevent these diseases from exacerbating these chronic diseases and then thus requiring inpatient admission. And when all of that happens around the same time, just like in COVID-19, then it can be a significant stress on any hospital. But there are efforts to do what we can. We've GMH has tried to improve their ability to take back some non-COVID cases or start just really doing more non-COVID admissions instead of redirecting to GRMC.
Wait, so the GMH, which was the COVID hospital, is now going to be a COVID non-COVID hospital? Now they're going to.
Well, it's always had non-COVID cases, right? In terms of patients overall. So obviously there's the pediatric.
Right. Okay.
And then there are some of the adult patients that are seen in the emergency department that are not COVID. And that are admitted through that process, the normal process. So it's not like it's been completely extinguished in any way. We've never gotten to that point, thankfully.
Yeah.
And so, but I think it's just this pendulum that is just swinging. It's just swinging on its opposite end at this point.
Mm-hmm. Okay.
Yeah. What I wanted to share also is that what I learned is that GMH had discharged its last of COVID-19 patients, I think as of yesterday, and so their count right now is I think technically zero COVID-19 patients that's in the inpatient setting, which is a great accomplishment. But we know that that's not necessarily a time to celebrate, and that that there could be still more cases that come after this. But it's something that I think it's worth taking pause to recognize that this achievement that I think all of Guam can take credit for.
And when you say that this doesn't include like PUIs, or that is what you're saying?
Yeah, these are the confirmed COVID-19 cases.
So, but they still might have PUIs there?
Yeah, and every day we have PUIs basically, and what's good, and then you see the reports of that basically in that day, in terms of the positive reports that there's a lot of times zero to only a couple, and the ones that are a few are the ones that come from that are in the community and not requiring admission. So that's been great. But I know we're up against the hour here, but I just wanted to mention that we may be doing a press conference today that's mainly the state surgeon cell. And so being able to address any other questions the media may have directed to the state surgeon cell.
Cool.
And then on top of that, we have some other insights that we want to share in terms of our state, how things are right now in terms of the trends and what our current state is with the COVID-19 pandemic overall.
Okay.
Thank you.
Thanks for the heads up, Doc. And,
okay.
And thank you for your time.
Of course, yeah.
Okay.
All right, take care.
And wash your hands.
Be safe.
Yeah, we will.
Okay, Doctor.
Okay, bye.
Dr. Cabrera. Hey, we'll take a little break and flick the switch and start up on KUAM TV 11. We are KUAM FM in Hagåtña, Guam. It's the KUAM News takeover of Guam's favorite I-94 containing COVID. Good morning.
Be healthy. Be informed with ITD.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc. Be healthy. Be informed.
Self-storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Hafade Guam, Adriana Cotero here, and I am currently reporting from home. And I encourage every single person in this community to stay home. COVID-19 cannot survive if we do not feed it, and that means staying home and washing our hands. Now, I know I've heard people my age in their mid-20s say, it's okay, we're young, we're healthy, we have strong immune systems, we could fight it. That's not true, and we also don't know who we could potentially be exposing. The only way that we can fight it is if we stay home. It is our duty to stop the spread and to stay home. Be safe, Guam.
para y honra Viva isla sen para que todo e tempo e paz para ita dan kini langit na bendisyon contra e peligro na fansa fuham Deus protege Island Guam contra e peligro na fansa fuham Deus protege Island Guam. Ay sinati untungo tagi ningo puthagu Zatiwa saka hau zangin undingu Lohuli hau gipanyi Zahan lagu gi matamu Zahapata tu maski pabel sangan Lau tiu hongi telu Napon naputi du nai pogu Ni guahu gagagi magagi fionmu Apu magi gapagang Labil sangon ni historia Sahabu zahu Apu magi gapagang
Per capita, your most Chamorro radio show. KUAM News Takeover, Guam's favorite. I just gotta let this rock a little bit. Well, they don't make them like this anymore.
Jason's over there. I was like, what's this song?
Yeah, Jason's like, huh, who is this? The kind of song you put your lighter up in the air, the old school way. Good morning. It's 8:10. Good morning to you on our KUAM TV 11 audience. Remember, there's just so many ways that you can help us to contain COVID. You catch it on the radio right here, Guam's favorite, 93.9 FM, Agotnia. It's also streaming on the KUAM News app and at KUAM.com. There's a audio stream, Docomo Channel 10. And we're also on KUAM TV 11. Okay? Hi, good morning. Okay. And last but not least, to our viewers on Facebook Live, the KUAM News Facebook page, good morning on you. Please watch, share, question, comment the broadcast. It's real information, real time. And let's get into some real information right now as we take a deep dive into the day's COVID-19 news from the KUAM News team. Sabrina Salas Matanani. Good morning.
Hafaday and good morning, everyone. Here is the latest from the Joint Information Center released at 11:15 last night. Public Health, they tested 110 individuals for COVID-19 on Tuesday. One tested positive. The results include samples from COVID-19 expanded testing in Estumbo, Dededo. To date, there are 145 confirmed cases of COVID-19 on Guam with 5 deaths and 129 recoveries. Public Health, in the meantime, will be back at the Estumbo Gym community testing site today, and this time it will be open to everyone experiencing COVID-19 symptoms. The testing today is from 3 to 6 o'clock p.m. On Thursday, April 30th, testing for Central residents will be conducted at the Mangilao Senior Center from 3 to 6 p.m. And then on Friday, May 1st, from 1 to 4 p.m. for Southern residents, they can be tested at the Agate Senior Center. The testing is free. All residents with COVID symptoms, you are urged to bring an ID. The Federal Emergency Management Agency now has several more people on the ground responding to the COVID crisis on Guam. FEMA spokesperson Frank Mansell says in addition to personnel, the federal agency has provided thousands in medical equipment. According to the breakdown, and again, this is from the strategic and non-strategic national stockpile, as well as from donations. This is what has been provided to the government of Guam thus far. 56,095 masks, 25,000 surgical masks, 10,000 surgical gowns, 8,000 face shields, 93,000 gloves, 3,000 biohazard bags, 59 ventilators, 2 50-bed federal medical stations. And these are some of the government of Guam's asks, what they are requesting from FEMA. Shoe booties, hand sanitizers, face shields, coveralls, disinfectant wipes, and tents, which is currently being reviewed by FEMA. And those tents are for the homeless shelter that is anticipated to open at the Paseo grounds in Hagåtña. In news from the CNMI, Governor Ralph Torres announces that the CNMI Nutrition Assistance Program will be distributing benefits through drive-through services again at their office location from 8 a.m. to 3 o'clock in the afternoon from May 1st to the 15th. This means eligible households will be issued their benefits to them while they are in their vehicle. The purpose of this drive-through service is to ensure safety and protection of the public and NAP personnel from COVID-19. There will be no walk-in service during that drive-through period. As for an update on the USS Theodore Roosevelt, the number of active cases remains at 955, with 14 recovered. 1 sailor remains at Naval Hospital, and 0 are in the ICU. In national headlines, the United States is quickly approaching 1 million cases of the coronavirus. There are more than 56,000 U.S. deaths. It comes as more states have started to ease stay-at-home restrictions. Michael George reports from hard-hit New York, where the stay-at-home restrictions set to expire May 15th will likely be extended in some parts of the state.
Texas is returning to business. Starting Friday, the Lone Star State will allow restaurants, retailers, movie theaters, and malls to operate at 25% capacity under strict social distancing guidelines.
I'm happy that we can see the light at the end of the tunnel.
But the state's daily COVID cases have been hovering in the high triple digits for most of the past week. At least one Dallas restaurant owner says he won't be reopening Friday, even though he can.
I'd rather take our time getting back and make sure that that curve is fully flattened or on its decrease.
At least 21 states have now eased various restrictions, in many cases without meeting federal guidelines on the decline in reported illnesses. In Georgia, many restaurant tables sat empty, even though dining areas reopened Monday. This Montana mall was also back in business with a small but steady stream of customers.
I think that largely most of the folks are observing the social distancing.
While other states are opening back up, officials here in New York City are planning to shut down 40 miles of roads to cars next month to allow New Yorkers more room to walk around while social distancing. And this social media footage from a passenger on an American Airlines flight from New York City to Charlotte over the weekend clearly shows a lack of social distancing, and some passengers are not wearing masks. In a statement, American Airlines said it's limiting the number of passengers on each aircraft, and gate agents will also continue to reassign seats to create more space between customers. American plans to offer masks and disinfectants to passengers starting in May. Michael George, CBS News, New York.
Report from Bank of Guam and Coast 360. Bankers Association members are collaborating to assist the community in cashing their stimulus checks. If you are check cashing is allowed for non-customers at Bank of Guam, Bank of Hawaii, Bank Pacific, and First Hawaiian Bank. And also the Bank of Guam, their Tumon branch drive-through window, it is open 9 a.m. to 1 p.m. That is Monday through Friday, but it is closed on Saturdays. Utility check payments may be dropped off at the express deposit box. And that is your Banking 671 report from Bank of Guam and Coast 360.
All right, and now let's go over to Nestor Lecanto from the KUAM news team. And Nestor is standing by with the latest on the governor's the actions that she took yesterday on several bills that were sent to her desk by the legislature. Nestor, what do you have for us?
Good morning, Chris. Good morning, Bree. So actually, the governor acted on 6 bills, but there were 9 bills that the senators debated when they recessed on the 17th this month. The 3 bills that were not sent to the governor, one was Speaker Barnes' bill. You recall, her legislation was basically to enforce the governor's executive order would impose fines. Well, this is really the checkpoint bill or the roadblock bill. it would put some teeth into that. She set that aside, and at this point, that's moved because the governor has since, of course, got rid of the roadblocks. The other bill was Senator Regine Lee's bill to hand out $400 or $800 local stimulus payments. She set that aside when the governor announced that she was going to advance the federal stimulus checks for the lowest income families who make $10,000 or less a year. But she's since rekindled that now that the governor has received over $118 million. So Senator Lee is now saying, wait a minute, why don't you use some of that money to pay the folks that would have been eligible under my bill, which I set aside. The other bill was Senator Amanda Shelton's bill, which would basically have authorized a curfew. That did not pass. It failed by a vote of 3 to 12. The three who voted for it were Senator Shelton, the Speaker, and the Vice Speaker. So those three measures were off the table. The three measures that the governor signed was Senator Mary Torres's bill, which waives the requirement for a 2% set aside of the total revenues for a rainy day fund. The other two had to do with the Department of Education. Basically, we all know that the school year is essentially over for GDOE, so these are just kind of cleanup bills that exempt, for example, the service learning graduation requirement for 12th graders, and it also exempts that requirement for 180 days of instruction. Those are the ones that she signed. The three that she vetoed were Senator Talina Nelson's bill. This is probably the most controversial one. She vetoed it because she said in her veto message that it's double pay. This is a bill that would provide for hazardous pay. There are three different categories depending on how your proximity to the COVID virus. So it went from 25% to 15% or 10%, depending on how close you are to, or how vulnerable you are rather to being infected. So the governor says that that would have added a $36 million obligation to already taxed government funds that would, in her words, cripple the government's budget, and that she had already signed an executive order for differential pay. So this would have made it retroactive for both the pay differential and the hazardous pay, and that's the reason why she vetoed it. And then there were two bills by Senator Therese Terlani, and I believe we have Senator Therese on a little later. She could probably, she could explain it much better than I could what the purposes of those bills were, but according to the governor's veto message, she vetoed Bill 333 because it places additional reporting and implementation requirements, but those are already required by federal law, so she said that was legislative overreach in her words. And the other one was Bill 336, which she says, while it calls for expedited procurement of critical emergency equipment, it does not grant new procurement authority. So you're telling me to, in other words, if I can interpret what she's trying to say, she's saying you're telling me to expedite procurement, but you're not giving me authority to procure it. And you can have Senator Therese respond to that. I'm sure she's got plenty to say. And so that's the rundown. 3 vetoed, 3 signed, and 3 didn't make it.
Well, thank you, Nestor. We do have Senator Terlahi on the line, so we'll go ahead and just get right over to her. Appreciate it, Nestor.
Thank you.
Real quick, can you tell us what are you working on for today?
Well, we're anticipating the governor's public briefing, but I guess you had Dr. Felix on saying that it will not be her present because she's busy dealing with the eventual recovery plan. So I think the medical experts will be the ones we'll be talking to.
Right, yeah. So we did get a message on our COVID-19 press conference chat from Janella Carrera, the governor's communications director. Hafaday Media Partners, there will be a press conference today via Zoom at 1 p.m. However, it will only be with the state surgeon cell. The governor and DPHSS director Linda DeNorsi will not be available as they will be touring military sites.
Okay.
Going on base. Okay.
All right.
Thank you,
Well,
Nestor.
no, I wanted, before we go, we're actually launching your new show today.
Yeah.
I'm really excited about it. If you want to tell people about In Full Zoom.
InfoZoom, yeah, thanks. Today we have Simon Sanchez on, and then we also have invited from the real estate experts, Liz Duenas and Gina Campos, to talk about how this COVID-19 crisis is affecting their respective businesses and companies, and what their plans are once we do emerge from this, how to get back into a thriving business. What are the challenges, and what do they need from the government to help them out? Because this is going to be a very difficult situation. For example, the tourism industry. Okay, we reopen, but there's not going to be any tourists because it's all dependent on how, in particular, how the Japanese and Korean visitors, when they feel confident enough to travel again. So just reopening your business, of course, doesn't automatically mean you're going to get back where you were before this whole thing started. So that's some of the discussion that we're planning to do.
Good. Yeah, looking forward to that, Ness. I mean, you have that whole business acumen thing down, and the people you bring on. It's always very enlightening.
All right.
Thank you, Ness.
Nestor.
Wash your hands.
Thank you. Yeah, I will.
Okay. Nestor Lecanto, the Walter Cronkite of Guam, as he's been called in our Facebook comments.
So yeah, in full Zoom, that's going to air on KUAM TV8 tonight, 6:30 p.m. But I believe his interviews are live at around 10:30, 11:30,
11 a.m.
11. Okay, 11 o'clock.
Right on.
Check that out on KUAM Digital.
8:24. Let's get the Legislative Health Committee Chair, Senator Therese Terlahi, onto the show here. Good morning, Senator.
Good morning, Chris, Sabrina.
Good morning. Well, not a good night for you, huh?
Oh, well.
You got the big fat veto.
Twice.
2 big fat vetoes.
Were you surprised, or were you anticipating it? I mean, weren't both bills passed unanimously?
They were both passed unanimously, and in fact, we went out of our way to make sure that these bills were not going to impede any efforts. They were only going to, enhance any efforts, hopefully, and really, they were mostly focused on transparency, accountability. That's what we wanted. And the governor says, don't worry, we're going to report this because federal requirements, But the issue is, we want to know. We are the legislature. We're facing a huge drop in revenues. It's going to impact, it has already impacted every single individual on Guam. So when you put in that huge loss of, local revenues, and then this huge power that has been given under our, public health emergency law to just a very few public officials, and together with this huge influx of federal cash, unprecedented, all we were asking for in these bills was that, the administration would report to us, show us the agreements that they're signing with the federal government on a timely basis, show us the expenditures that they are making with this federal money. Pretty much that it's reporting, and I thought we actually had in one of the bills lifted, any local restrictions that might impede very prompt action. And I know you guys are doing a very good job on your program talking about how the people of Guam are suffering, and so it's been this way for weeks now. One of these bills was drafted when, after weeks of the government not having procured, essential supplies for our frontline healthcare workers. That was really one of the biggest driving forces of Bill 336. It was allowing extra transfer authority because, in the beginning, we talked to everyone. They said, "Oh, don't worry, we're going to get all these things." Then weeks went by and we didn't get those things, and we had nurses calling us, crying about why are they limiting us with PPE? They're making it sound like they don't have enough, and that actually was the case for a while. We did not have enough ventilators to match the projection of our needs by the health officials, by the health experts. We did not have the amount of test kits that every government is aggressively, trying to get. And so all those, they were crucial items, and, we started to hear, because of the limited funds that we have, we can't buy them in bulk. different reasons, and I think the legislature, acted unanimously because we wanted to make sure that money was not going to be the excuse we were given that the items could not be procured, and so we pretty much, tried to open those channels, and then we tried to direct that, that the priorities would be those healthcare supplies, housing for nurses that are, don't want to go home and possibly infect their families, housing for COVID-exposed homeless. That, at that point, none of that had taken place. None of those supplies were here, and none of those services were provided.
Well, we're still waiting on the homeless plan.
Yes, we are, and and I've been hearing the talk about it, being a tent, like a tent city. I don't know. What I'm really hoping that, and the other bill was pretty much, we had not, and we still have not received the plan of how they're going to spend this federal money, the $118 million, unprecedented, right, federal money. And again, it might be, the bulk of the money we're going to get this year. I mean, compared to our revenues, right? So how we spend this, it's going to have long-lasting effects. If we have to be very wise right now. But we have not, we as senators, we've not seen the plan of how we're going to spend all that money. What would the priorities be? And what I want to know is, how is this going to better us going forward, as opposed to, just temporary measures. I would hope that we can use this money, in a very wise way, because it's going to have to last us a long time. Some of these fixes, for example, what are we going to do in the hospital that we are going to ensure that we have capacity going forward, for sure, right? And so I'm just hoping they use it, to make some more permanent type improvements that we're going to use. And we all know people are losing health insurance, or they've lost health insurance when they were laid off. So many factors that are, affecting all of us.
Well, because these bills were passed unanimously, what have you talked to your colleagues?
Yeah, because
given you any feedback, or they just as
well? We got this veto message. I got it when the media sent it out, 8:30 or something.
Typical.
And I found out later it was delivered to the legislature earlier than that I was not made aware. So, but so when I did see it, I haven't had a chance to talk to my colleagues yet. I'm sure we're going to be talking today because of the different veto messages, and there's still some pending efforts. For example, we're waiting anxiously to move forward with the ability to have public hearings. I've been asking for this for quite a while, because I think this is where we're at. We are unable to have, to hold anyone accountable.
It's crazy, Senator. It's crazy.
Yeah,
you guys are a whole branch of government who is supposed to be a check and balance on the executive branch, and you guys have been effectively sidelined.
Well, we're not, but definitely have not been receiving the information promptly, and which is really what I thought would be harmless. I thought if you have to, report, that's harmless. Why would anyone, not want to do that? I just feel like that is, especially now,
because it's an overreach of your legislative authority.
Well, I don't believe that at all.
I didn't say
if we're not a legislature that's going to hold the executive branch accountable, then we are useless, right? And it's not even, we're asking for reports after the money's spent. Even, we're asking for the agreements after they're signed. We're asking just for the information. We weren't even trying to
overreach.
Influence how they spend it. We would like to see that, because this impacts the FY20. It looks like we're going to have to redo the entire FY20 budget. FY21, of course, revenues are going to be looking good. So I think that's what we're there for. We're there to make it better, even, if it's not just to be critical of how they decided to do it, but hopefully if we were all working together, we could make it better. I've always found that to be my experience, is that the more you show, what you're working on, the more people can make it better. And that's why, I appreciate the public hearing process, because, the ideas that come in are always, it's always geared towards making an improvement. And I just think that's what we need. We need everyone to know what's going on, if you want them to trust you, right? Then don't hide anything. Let them know what we're looking at. Let them know when supplies were low, everything about it. Let them know what this money is going to be spent on. I sent a letter, a week ago or more than that, to Ed Byrne asking, for the report or the documents that he submitted to the federal government. He said this was, I have to ask the governor because she's the one who's going to be able to spend the money. So I don't know. It's no one here is trying to take away authority of the governor to act swiftly. I think we are trying to enhance that. But what we don't want is, we don't want, we don't want to cripple the government either, right? We have to know which agencies are not going to get any of this federal money, what services the people of Guam are not going to receive anymore based on revenue and based on, priorities from this federal fund, so that we can act wisely as well. That's really all there is to it. Without information, it's not our best government. I think it's always our best when we share the information.
Yeah.
I wanted to see how you interpreted this. This was in the veto message for Bill 336. It says the governor vetoed this bill in the interest of statutory economy. Well, what does that mean? How do you interpret that?
I don't know. We were trying in that bill. I'm not sure what those words mean, but we were trying.
Is that some legalese there, Senator? You're a lawyer, aren't you?
Statutory
economy. What is that?
I don't know, but all we were doing in that bill is the public health emergency statute authorizes the governor specifically to transfer up to $100,000 a month. And when we were talking with their experts about the cost of these supplies that I just mentioned to you, the costs they're huge, right? And some of them they wanted to buy in bulk. So we just wanted to lift that cap of $100,000 a month, which it was my understanding they had already spent, and increase it. So she's saying she doesn't need that money. She's got authority to spend other money, which is fine, which is why I'm not going to go for an override on that bill. I'm going to just ensure that they're held accountable on the funds that they have transferred for this emergency, that they are spending for this emergency, that they plan to spend from the federal funds on this emergency.
You guys aren't even aware of who's getting what contract for what or anything, are you?
No,
in fact,
idea. Yeah, I'm no, and we.
It's ridiculous.
It looks like we're going to have to send FOIAs. Yes.
Wow. Well, let me know. I'm good at sending FOIAs. If you want to,
you guys actually,
I just sent 3 this morning.
They've sent FOIAs. They've sent questions. I've sent questions. Sometimes I get answers. Sometimes I just get a response that says received. That my letter's been received. But I don't. Yeah.
Thanks.
You know what? Yeah. Well, I just feel like I don't know. I'm not. I just want the people of Guam to trust the government officials, right? And I just want us to, I want us to, well, no, Chris, I'm never going to give up on that. Yeah. I really feel like we just have to do it. I mean, that's why I ran for office. I want to change that perception of the government and show that we actually are very competent. There are competent individuals working in the government. We've seen this. The problem is when they get, interfered with, or political interference. This is really a problem, and that's why it's hard for us. We can't hear directly from the medical experts fast enough. We can't hear, I don't know. For me,
go ahead.
You can hide information if you want, but when we are facing this outcry from the public of, they're not trusting almost anything we say anymore. They want to know more. And I think that they're completely entitled to know everything there is, about the money, how it's going to be spent, how it already has been spent, why wasn't it spent on certain things, all of that. All
right. Bill 326, another bill that was vetoed, again passed unanimously. What is your reaction to this? Because you said it would cost an additional $36 million just for payroll. And this is the hazardous differential pay and then the double pay also for essential employees.
Yes. Well, again, we've seen the veto message like you. There's no accompanying documents to show, how they calculated the impact. What is it that's really the issue there? We're guessing the issue was, double time versus the what do they call it? COVID pay, the step pay, and so it's like when we were in session. We did not have the benefit of the AG coming down and explaining all of his concerns to us. We just received a letter from him. Same thing with no fiscal input really was given on that bill. So we're operating in I don't know, unless we get more information going in this time on on another bill regarding that pay and I know that originally the intent was to make it effective back to the date when the emergency started.
Retro.
The problem was there was a conflict. There was very obviously a conflict between, prior rules and regs that allowed for double time and this type of pay. Yeah. And the double time or double pay, whatever it's called,
isn't that already authorized in law?
Correct. For other emergencies, the rules say that they are supposed to use they're entitled to double pay.
So the new part of this was that the governor's
sliding scale.
Yeah, sliding. Yeah. That's what I was trying to say. The sliding scale differential pay, the COVID-19.
Correct. And so the question was, does that get added on top, or does
the double?
Right.
Okay.
Yeah.
Or is that the exclusive type of pay for these employees?
How do you regroup after this, Senator? I mean, you're asking for such basic information. You're not, asking for anything classified. You're not asking for anything that's in draft form. But I think that this is not just a rejection of your measures, but these measures were unanimously passed. So I kind of view it as a rejection of the legislature overall. So how are you going to make those renewed calls for more transparency that are being echoed by the mayors, that are being echoed by the people of Guam, that are being echoed by the media? So you're not alone in this, and we're just wondering, how do you regroup after this?
Well, I think even without talking to the other senators, that just having spoken with them before, I feel very confident that all of them want increased transparency. All of them know the demands of the public for increased transparency, and all of them who are supposed to be decision makers, take it very serious. We don't want to make decisions in the dark. That's silly, really. And so I just think the sooner, the better. Otherwise, we're sitting around while people suffer. And I just think the more the information shared, the faster it's shared. This is what we are called to do in public service. It's that. I think, we need to, at this point is very clear to me, trust is a very huge factor in how we are going to move forward. Opening, not opening, in putting on additional measures, whatever we are going to do moving forward, our revenues are going to be down. So we're operating in a whole new world here, and trust is huge. It was huge in the beginning, and I really believe they had that, but I don't understand this continued, we're not going to share the information. I think that's a I know I'm going to give credit. People are working very hard. I just think that's just an error, that they think they need to hide information or show it to us only, after everything's all done, and
it's too late to stop anything.
Accounting to the feds, right, yes, yeah. Because it's not the feds who hired these employees in the government of Guam. It's not the feds who determined, what the government of Guam agencies are going to do. It's not the feds who determine, what the services we, the people of Guam, need. or what we're going to provide for them. That's all has to be done locally. We have to work together in this. We have to provide the services that we know at this point, or we should know. Or I think we're hiding under what's that saying? Hiding under the leaves. If we don't know that people are going to suffer for quite a while. Yeah. That even this stimulus, $1,200,
it's already gone.
Going
Senator.
to go very far. Yeah,
yeah.
I think you've been saying that on the radio, Chris.
Yeah.
And I know, Sabrina. Yeah, I can hear it in your voice. Your media, and maybe this is we're all experiencing this for the first time. The world is experiencing this. We watch other states how they do it. I watch how they get very aggressive on getting supplies. And I admire that, and I admire how some of these leaders, I think that's the key to building the trust. They're willing to lay everything out.
Right. And they are. And I think that, we're only made more aware of how governments can and maybe should respond with transparency, because real time, all over the world, they're still fighting this thing. And I just got to say that I know that transparency was one of the key tenets of the Lou and Josh campaign, and I just want to, go back to that.
Well, it's not too late. I'm just going to say again that I'm not going to give up on that. I'm going to, I think we've got so much work to do in addition to this federal money, ensuring that it actually does as much as it can do for as long as possible for some real, systematic changes on Guam. I'm hoping for, especially in healthcare, right? That we are ready. We are always ready from now on. That's what I'm hoping we're going to get out of this money, and that the people suffering, that they're going to get some relief as fast as possible. Those are my two priorities, and of course, there's so many other things that we have to do just to, build up an economy, but. Yeah. But really, those two things, it's the suffering on an individual, by families, and not just from isolating ourselves. That was our first problem, right? We were not used to isolating, but now it's gone so far way beyond that. It's now a matter of really how you feed people, how you give them very basic needs, and how we build our healthcare system so that we go forward without worrying that more people are going to die.
I think you're right. Yeah. Got to get ready for what might come in the fall.
We're so lucky. That our healthcare system with GMH, and you've passed bills. You've tried to throw money at the problems at the hospital, but I just feel like we're so lucky we dodged the biggest bullet with this COVID-19. And there's still firing shots from the gun, you know what I mean? But I would hate...
What did Dr. Cabrera say? He said there are 0 COVID-positive patients right now at the
GMH. Yeah. Right.
But that could change.
I would just hate to see that after all this COVID, after we got that $119 million, that, when everything's back to whatever normal is going to be, that you're going to go to the hospital and there's still going to be a broken elevator, there's still going to be a roof leaking, there's still going to be the electronic whatever, it just would be a damn shame.
Exactly. And I think, same thing with health insurance, right? If we already know and we can predict how many people have lost health insurance, we know for at least the next, 1 or 2 fiscal years, this is a huge shift, and it's going to be a huge burden on our hospital systems. And so in addition to COVID, that loss of health insurance for all other types of disease, it's huge. And I think some of the clinics, they call me that this is some of the problems that they're facing right now. They've got people who have just been dropped off of health insurance and are not seeking the care that they need. I also, I've also, I think I was on your show before talking about how I've been also asking them to make a shift in our government, and, when we release the refunds, tax refunds. Yeah. And I just think, I don't know, to me it makes perfect sense, and I know to many other senators, they've also been making the same call, but I don't even think we need any more legislation to pay the rest of the 2019 refunds that have been filed and have been processed. I'm so impressed by Revenue and Tax. They've processed these things, and so we're not waiting as much on the processing as we are just, waiting on the payment. Right. So I want to make sure that, when we readjust our budget going forward, or tomorrow, hopefully, right, immediately. These things need to be done as soon as possible.
Yesterday.
That we account for all the 2019 tax refunds, that those get paid out before we crash. I mean, you know, I don't know what the revenues have in store. We're looking at the predictions, and they actually look much better than I expected. So I hope those are correct. But you know, if we plan for the worst, then I just feel like we need to get those refunds out so that people get their own money back, and then we deal with the rest on ourselves. But so we're very much looking. We're supposed to be starting up virtual hearings next week. I'm hoping we can, get that approved in the Committee on Rules this week. So I'm very much looking forward to that. I think it's going to be difficult to do virtual hearings, but this whole experience has taught us to be very flexible, right? We've got to shift everyone, and we've got to be patient with each other while we make all these shifts. But it's also at a very fast pace. We can't afford to wait around. We have to. I think if senators need to be in the know, and the public needs to be in the know, because it's the public who's, they're the ones carrying the burden for us.
I mean, we're the ones that are walking around with loaded guns, as a metaphor, And Senator, I just want to go back to they don't want to give you the information. There's no transparency. The local assistance. Each one of us is going to be heading into the election, whatever election we're going to have, and people are going to carry this with them into the voting booth, and I think that there's going to be some mass casualties at the Guam legislature. Sorry for all the dark metaphors. Sorry.
Well, I don't know.
I've been talking to Dr. Cabrera too much.
It's very hard to talk about elections at this time.
I know.
And, for me, but I know, for the public, sure. I mean, that's probably how this all translates, right? But for me, we still have time. It's just a matter of, we're trying to make things faster, more efficient. We're trying to allow the flex of employees, the redirection of employees and resources, so that we can get those tax refunds out faster, so that we can, there's no impediment to the unemployment rules, that there's no local impediment to the payment of those stimulus funds. And Guam, we have a unique circumstances, so I don't think, and neither of these bills would have created an impediment except for reporting, and even after the fact reporting, right? And so if you find that to be an impediment, I don't know what to say. But for me, that was absolutely not an impediment. It's actually good government, and that's what we're asking for.
Okay, Senator.
Better government.
Thank you.
Thank you.
Thank you.
You too. Thanks for all your work. Appreciate it very much. Take care.
Good luck. Keep us posted.
Will do. Yes, thanks.
And wash your hands.
Take care.
Okay, there you go. Senator Teresa Lahi, the Legislative Health Committee Chair.
It's like the leader of the Trustus League. The Justice
the Trustus League.
The Trustus League.
Yeah. I mean, the pure motive. She wants the people to trust the government, and, she's frustrated because people in the government are doing things that are making us not trust them. Like, we talked to Linda earlier about the governor's chief of staff being put up at Pacific Star. Interesting, to say the least. It's 8:50. Bree, we're going to take a break.
Yes.
And we're going to come back with more of KUAM News' takeover of Guam's favorite. It is Containing COVID. Good morning.
Pay full price. Be healthy. Be informed with ITD.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Hafaday Guam, Adriana Cotero here, and I am currently reporting from home. And I encourage every single person in this community to stay home. COVID-19 cannot survive if we do not feed it, and that means staying home and washing our hands. Now, I know I've heard people my age in their mid-20s say, it's okay, we're young, we're healthy, we have strong immune systems, we could fight it. That's not true, and we also don't know who we could potentially be exposing. The only way that we can fight it is if we stay home. It is our duty to stop the spread and to stay home. Be safe, Guam.
Self-Storage, conveniently located near the Harmon McDonald's, offers fully covered loading and unloading area with individual pin-coded gate and door access. Call us today at 648-7867 for more information.
Specialist Joshua Mansonotia. I can't wait for him to come home. Keep us safe and stay home. I miss my daddy, and I can't wait to see him. So keep us safe and stay home!
8:58. It's the KUAM News Takeover containing COVID. What a morning. As always, every day is a new day. April 29th, it's Wednesday, 8:58. Can we go over, Bree? If we're
No. What do you want to go over?
The guidelines for the community testing.
Tomorrow, yeah.
Or today.
I'm
today,
sorry,
too.
yes,
Yeah,
today.
3 to
There
6.
is testing again at the Estumbo Gym, and that is for everybody. Everyone that is experiencing COVID-19 symptoms, please check out the Estumbo Gym. That is from 3 to 6 p.m. Then tomorrow, Thursday, testing is going to be open for residents who live in the central part of the island. It's going to be at the Mangilao Senior Center, again, 3 to 6 p.m. Then on Friday, May 1st, it's 1 to 4 p.m. for southern residents. This includes Inarajan, Jotnia, Maritzo, Talafofo. If you are experiencing COVID symptoms, go to the Agate Senior Center to get tested. Again, that is 1 to 4 p.m. The testing is absolutely free.
There you go. And again, we're trying to test as many people as we can. So if you want to use Mayor Savars' COVID-19 testing hack, just say, I mean, we want to get people
Linda
tested.
said, come on.
Linda. Auntie Linda said, let's
tested.
go, boy. Come and we're going to test you.
Yeah.
Okay, so if they start asking you a lot of questions,
just say that.
Just say, I don't know, but it's really weird. But for the last couple of days, I haven't been able to like smell anything or taste anything. I ate like 3 spoons of Chris Barnett's Dadanci and it didn't even faze me. So yeah, there's ways that you can get tested and just do your part, okay? Get creative with it.
There you go.
It's 9 a.m. Let's get Manila Mayor Al Ongata, Mayor Ongata on the line here. Mangi Town. Good morning, Mayor.
Buenas and Uppity.
Hi.
Morning, Sabrina and Jason. Uppity. Morning, Bob.
All right, so let's talk about this community testing. It's happening tomorrow. I guess our first question is, how much of a heads up did you get?
I got a heads up right after they did their information from the, like I said, their planning stage, and then of course the fiscal team came out and we did an area feasible. Did the logistics would be located at the across my center.
Mm-hmm.
Of course, initially it was supposed to be the community center, but now it's over at the church / my night market and senior area. So it's a little bit more convenient with the traffic flow and accessibility. So the logistical part was discussed Monday.
So you found out what Monday?
Monday, the logistical parts were in the afternoon. We looked at the logistics for the area to be feasible. Correct.
Right. And so, Mayor, we're talking about the Mangilao Night Market grounds. So, how are you organizing the driving in and the driving out?
Okay, so if you're familiar with the church, and if you're coming from you're heading towards Barragata, you would be coming down from the Franny's, Chalmpago area, University Drive. You got the sidewalks there. You got also so you're going to be coming in between the social and the church, and that'll be the drive up, and then you're going to go around in the cul-de-sac where the senior, and then you have my night market stall. You've been there. You participated in the Doni Festival. So you're familiar with the area. Pretty sure you guys are familiar with the night market grounds. It goes in there, and then they're going to have their triage. They're going to force check the information ID, and then they're going to have the walk-ups on one side, and then you're going to have the drive-through on one side.
Wow. You guys expecting a lot of people?
Well, I know they're earmarked, like I said, several. I mean, there's a lot of talk about the 150 to hit 80. So, of course, I'm really encouraging everyone with symptoms or even if you've like any, not just the necessary, but whatever kind of things that
if you have a sudden loss of appetite or something like that.
Anything that can be of it, because now you got to remember it's not just for per se Mangilao in the center. You got I got neighboring villages like
Barragata, yeah.
Pago, my Zotnia, so it's extended out to over to MTM.
To Mooning.
Correct. So this is the thing now where we're in the central part. like I said, if they didn't already go to their primary physician or any of the medical clinics, like of course Manila has the American Medical Center. Now this is the opportunity where they can do the testing, and I believe I earmarked. I'm hoping that we can hit. I want to remain optimistic, and let's hit some numbers where we can get some validated information.
Right. Well, I think Linda said in Dedado today she's bringing 200, right, Chris? Yeah. And then she's got 200 as backup, and then I think she got a backup to the backup. Yeah. Yeah. She's wanting to get people tested.
Yeah, well, we got to give them props too. I mean, let's just be frank here.
Mm-hmm.
It started as testing as a pilot program, right? The outreach. Now you got it go running through Monday, Tuesday, and today, of course, Wednesday. So now it's been open to the different proximities, not just Stumbo. So just like vice versa, Manila, where it's centrally located, you got this different. Like I said, I'm pockets of 4 different directions here.
Yeah.
So whoever can get access, if you can walk by from areas where you can access the sidewalks, we got the sidewalks here. So the convenience and the layout is feasible, and I'm encouraging everyone to please come out if you feel any symptoms. Come and let's try to get some of these results and flatten the curve.
And for those who can't go out, just a reminder, you can go to your private clinic and you can get tested there. You can contact public health. They have 3 public health community centers. You could also get tested there.
Right.
And as we heard from Linda, it is free.
Yeah, I'm glad you brought that up, Bree. And a lot of that, I believe in the initial state was a lot of speculation, and also maybe on the light of who's going to foot the bill, right? So now that we know that it's free, I believe it will encourage them now to come at least any kind of feelings and do. Let's not disregard. You could have a stomachache. You can have anything. Let's go over there and get
diarrhea is one of the symptoms.
Free for symptoms of COVID-19.
If it ain't for your employer, then that's either.
Okay, it's time to mute you.
Yeah, Mayor. Keep it up. Keep it up. No, Mayor, appreciate it. I think we're going to try and touch in with you tomorrow morning again just to kind of get the word out there. But I wanted to ask, in getting the word out there, are you one of the mayors that you have the truck with the bullhorn? Are you going to be going around the village, hey?
Well, that's correct. But, also, too, and I want to say this, we're also doing the grab and go at the school. So
there you go.
Because we're heavily involved there. So when we're there, I also want to spread the word. Like today, again, I'll be there with my staff.
Right.
So we're going to try to get as much information and get at least a good consensus of, it's just getting that information out here. We've got so many outlets that are available.
Right.
And of course, even with the Facebook pages, the chats that they have, the neighborhood watch chats, so we're all sharing this thing.
Right.
And we're all trying to do our part. We're all concerned.
All right.
All right.
Well,
thank you, Mayor. I hope you win because we're making it a competition now. We spoke with Mayor Susuico. It's a challenge going out. Which mayor is going to get the most people tested? And I'll give you guys Denancy.
All right. All right. Hey, don't forget this September again. This September.
I'm your guy, Mayor. Okay. Thank you.
All right, okay.
Bye.
Wash your hands. Wash your hands.
Be safe.
All right. Mayor Alungata. Let's keep it on the phones and go over to Dr. Hoa. Dr. Hoa, one of the Governor's Physicians Advisory Group. Good morning, Doc. Thank you for joining us so late.
Hey, good morning, guys.
Gosh, you always sound so.
Well, I'm pretty sure you're in.
Are you tired? Are you all right?
No, it's okay, guys. We never get tired to fight this thing, so
that's right.
Keep on going.
That's the spirit, Doctor. So, what kind of morning are you having?
Oh, very good. I'm in my clinic now, so we still have patient care to be with. So.
Right.
What about your night? How was last night's meeting?
Last night meeting is very good. We talk a lot about make sure we have enough test kits and try to go over some plan to start opening some business. So there are a lot of things to do.
What can you tell us about that recovery plan, Doc? Because they're not really telling us about it, and you're kind of like our guy on the inside. So what can you tell us?
The governor have a lot of things on her plate, and the biggest part is to make sure that the recovery plan, we have to approach it in a matter of according to science, right? I mean, she's going to have a lot of people give her some data and all that kind of stuff, and we have to open the business, but in stage, You know, you have to make sure you open certain business, have certain guidelines for this to follow. No one going to go out and inspect them, but you know, at least all the business so far, they submit their plan of how they open, all the precautions they put in place in order to keep everyone safe. And you know, public health and our committee, we review those and we give input for her, and then she has to make a determination which one to open and what stage, and we have to make sure that we have our ability to test to make sure that, you know, if they have an outbreak or something, that we can test, track and trace and isolate those people. So everything has to be in place before she makes her plan. But I think it's very soon. I mean, everyone wants this to be open, but again, you know, we don't want to happen like on Hokkaido in Japan, that they open the business because a lot of pressure on the business side to open, and then they have a huge outbreak and they have to close back down.
How did they reopen though, Doc? Because I actually haven't got to Google that. But so did Hokkaido just do like a crazy, hey, we're open now, everybody come? Or was it also in a way that we're trying to do, gradual?
Yeah, Hokkaido, they have a very aggressive, shutdown plan, and they did. They shut it down for about 3 weeks or so, and everything kind of calmed down. And they decided to reopen again because there's a lot of pressure on the economy. And once they open, they find out it's not truly the people that travel from out of the country to come into that area for vacation, but truly the local community, the spread, that's the one that gets in trouble in the second surge. It's not the people from the Chinese and everything that are coming into Hokkaido, but there's a Japanese surrounding area that come in on vacation that have a second surge. So we have to be kind of open. You have the virus still out there. You know, we have a very low number of positive in the past, 10 days or 2 weeks or so. But we don't let your guard down. You know, we still need to practice our social distancing. We're supposed to wear masks wherever we go, and don't let our guard down. I tell you, it's still out there, and it will come up again if we put our guard down.
I think it's interesting to see how much effort is being put into talking about how we're going to reopen this economy. And there's an advisor group, there's all these people focused on let's get the economy, gradually back open. But yet I don't see the same effort when it comes to helping the thousands of people that are waiting in line for food. And
yeah, that's a big part. We really want to.
I mean, you guys can open it, but nobody's got money.
Yeah, that's the part. I don't know, the stimulus check and everything kind of falling far behind. And again, it's a big part is to get our community back to work again. So because people are running out of money really quick, So there's some plan there, and I tell you. I see everyone criticize the government, but she can open it and they go bad. They're going to criticize her. She opened too late. So there's no right or wrong on her part. No one wants to be in her shoes because everyone wants certain thing. But again, if this thing come back up again, it's all on her responsibility. So, I'm very sure that she's going to open very soon. She just has to approach it in a way that's safe for everybody, and make sure that people have food on the table and they're able to go back to work again in certain fashion.
Right. And so we know just through sources that there's a 10 a.m. meeting with the governor's business advisory group, and we're hearing that meeting involves the former governor, Carl Gutierrez, that he's kind of been folded into the loop. So, glad to hear that, Doc. But with you looking at the national news, you got 21 states that have reopened with some type of loosening of the restrictions. I mean, you talk about pressure, and we had Dr. Cabrera on a couple hours ago, and he said, Chris, if we started today, we had a plan, we went back 14 days, he basically said that we would have met the criteria that's being discussed.
The four criteria.
Yeah, the four different criteria. So, I mean, from what he's saying, if we had a plan, we could reopen gradually starting today.
I think that, like I said, she have a business plan today, and I know that she's going to meet us on Thursday, on the PAC meeting. So Like I say, probably by this weekend or next week, I'm surprised that she won't be open. I'm pretty sure she will open business by next week already. You know, I say the full point that we go from one stage to the next stage, we are there. You know, so right now the last part, that the fourth one is the tracing, the tracking of the patient. That we talked about a lot about last night. Make sure that if you have a recurrence of the virus, that we have people are going to make sure they follow right away and trace all the contact. So it's that is the last one, and I think it's come together nicely this week. So, like I say, she will open the next 2 days. I'm not sure when, but
what are we looking at, Doc? Because I know you know. So, what types of non-essential businesses are we looking at being reopened gradually, incrementally first?
Yeah, if I on top of my head, I think the number one thing is the restaurant we opened. You know, I'm not sure who's going to go eat. You know, it's going to be some 6 people in the table, and they have to do certain stuff like everyone had to be registered at the and everyone had to be checked for any type of symptoms before they come in. They had to wear a mask.
Sounds romantic.
I know.
Hey, throw me the salt.
So it's quite a few places will be open. The only thing I can tell you is the gym is going to be not be open for a while. You know, we have to.
Okay, can you confirm? I heard that there was a request, a recommendation made to the governor about reopening the gyms, and that was roundly rejected. Right? What can you tell us about that?
Yeah, I mean the people can exercise outside in the park and the street and you have a lot of places you can exercise outdoor, but when you put people inside the gym in a confined space and people go work out and you have the limited number of people there, and it's hard for the gym to be sanitized, every half an hour. People get infected in the gym. That's one of the highest risks of them all. So I think that as we open certain business, that's necessary for people to carry on their life right now, and we're going to track to see if we have a recurrence of virus or not. And and like I said, it's going to be a week or two to see what the virus stay low, and if it does, then we can open more and more and more. You can't open everything at the same time. So the biggest part is daycare. People need to get their kids in there to go back to work. So, we're going to open daycare, but we have to talk to them and make sure that the owner daycare are ready themselves. Because remember, most of the daycare workers, they are elderly people and they're older people. And, and kids are somewhat, most of them are mostly asymptomatic. So you don't want to get our elderly people get sick either. So it's a lot of things that you have to think about. So it's not that you say, oh, we open, that we're going to open right away.
Right, yeah. I think we just keep saying reopen. People have in their mind like, God, just flick the switch, everybody out, let's go. But it's not going to be like that.
In the recovery panel, is there different subcommittees that, there's the health that is comprised of people from the child care, or is it just this one group that's making all the decisions without reaching out to those different segments in the business community?
We have different subgroups, just like in
there are. Okay.
We have subgroups to work out some issue, because when you put a lot of people in one group, and nothing going to get solved. We got to break down to a little group in order to come up with idea, and then we'll bring back up to the table.
Okay, Doc.
But I think that like I say, she have a lot on her plate, and I tell you, it will be open by next week. I'm very surprised it doesn't, because once we met that 4 criteria, yes, we will open. But
I think people understand that the governor has a lot on her plate, and she's got really tough decisions to make.
I mean,
but there's also people out there
office,
that can't provide for their families. So
I think the people actually have it tougher than the governor. I think that's a safe thing to say.
But I tell you though, we really like to say thank you for everybody that followed the stay-home order. I think the reason that we have a so low of the viral count right now is a big hand for everybody. I think that this is why we can beat this curve because of stay home and people do follow that. So thank you very much for everybody to do their part, and that's how we get where we are right now.
Right. That's
true. So, again, when you venture out, keep the social distancing. Wear your mask, and wash your hands, and again, protect your elderly in the family to keep them safe for now. Okay, we're looking for the next few months to be back somewhat to the normal level, and hopefully during the flu season, September, October, that we can just deal with the flu and not the flu and the coronavirus. So that's what we keep our finger crossed. Okay.
Thank you, Doc.
You're welcome, guys.
Okay.
Be safe. Okay.
You too.
Of course, Doctor. Wash your hands.
Thank you for everything you're doing.
Thank you. And again, Chris Sabrina, tell everyone thank you so much for staying home and abide by the law. Okay? Okay.
Thank you.
guys.
Bye. Take care.
Thank you, Doc. Okay. 9:19. Yeah, thank you for staying home when you're supposed to stay home. Good morning. It's 9:19.
Yeah, even when they gradually reopen, you should, go do what you're going to do. Go where you're allowed to go, and then stay home.
Yep.
Wear your mask. Wash
Always.
your hands.
All that stuff. That's a part of the new normal. Jason
Stay
Solis.
clean.
Okay,
Bathrooms?
No, not the malls, not the
Okay,
bathrooms. I mean,
okay.
you can scroll back in our show and phenomenal conversation.
I thought we settled that.
Yeah. I mean, it's always going to come up as far as I'm concerned. But it was brought up in the chat room that this is the first time in human history when people are actually being told to basically kick back at the house and do nothing.
Mm-hmm.
You have free reign to basically be a couch potato.
I'm sure. Like, how do you save the world? Right? Just by simply staying home?
Yeah, no, and people are saying it's, we on Guam always say, we never back down from any hard work, and we always, emphasize how tough we are. The way you can show how tough you are and not backing down from a fight is staying home. Show you've got the resolve to actually do the right thing. The planet is in this together.
I gotta say, if you follow this guy on TikTok or
boy,
you gotta check his stuff out because he is quite entertaining.
I like to do camera tricks on TikTok. Let's just say that I'll mess with your mind. So.
I love watching.
Oh, but no, you know what? I'm glad you brought that up because the amount of young people that are on TikTok, especially like locals, they were like, and they're all respectful, right? These are kids, and they're all staying home.
Mm-hmm.
But they're like, "Sir, I didn't know you guys are on here too." And then much like the way that you and I found during the North Korea missile crisis when we were doing Instagram Live every night in the show, these are young kids who just want to know. It's like, okay, can you please give it to me straight because I'm not watching a polished, well-produced newscast. I'm just talking to you now one-on-one through my phone.
Mm-hmm.
Are we gonna be okay?
Yeah.
If I get sick, is it gonna hurt? Am I allowed to hug my mom again? Can I go to my Nino's house and everything like that? So kids just want to know what the real deal is.
Yeah.
And you can really reach them on their level. So that's one of the things. Go on social media and exchange with people.
Jason, but you're not talking about the COVID.
No,
you're
because
out there doing crazy stuff.
I'm making a video about I'm bored in the house and I'm in the house bored.
Well, Ken's here, and I know that
yes.
he's got something special that he's working on or helping with the Guam Department of Education. And
why don't
really
we actually bring the man, the myth, the legend in here right now? Yeah, Ken St. Nicholas is over here, and big news. Speaking of kids staying home,
and actually, I think this is up your lane, so I'm gonna move over so that you and
Ken is
Ken
here.
Can geek out.
Okay, geek out. Yes.
Okay, where are you going? You're gonna leave me with these guys?
Okay.
Yeah, they're going to
Okay.
geek out.
Yeah, so we're just gonna geek out momentarily. On
Go ahead.
Guam Department of Education, they're doing this, and I really thought it was a typo.
No.
Esports, and so we're gonna bring Ken Sanity. He's at Ken Sanity on Instagram. He's also known as one of the greatest Magic. Are you still doing Magic the Gathering during the COVID crisis? That's a gathering.
No, I'm retired. I'm retired from Magic the Gathering.
He is in the Magic the Gathering Guam Hall of Fame.
Wow.
All right,
The
and he's-
accolades. Are
I'm
pouring
telling you, he is the arguably the most productive gaming champion the island has ever produced. Ken St. Nicholas.
Well, you certainly are the most active when it comes to like organizing, people and building a community of gamers. That's been your passion for many years.
You've done a couple tournaments, yeah.
Sure, yeah, definitely. We did the Laddie Esports League. We did the Laddie Esports League last year, and we did many tournaments for over the past 10 years. But today we talk about the ISA's new offering for students during this fourth quarter, which is the ISA Esports League. So with the cancellation of fourth quarter sports, Al Grito has put together a activity for the high school students. It's a esports gaming tournament, and it's fully online. So during the lockdown, students can contact their school representatives to participate in this tournament.
Okay,
and
now
I think Al's going to come on tomorrow
Ken,
to talk about that.
Just real quick, people maybe my age don't even know what the hell esports is.
Esports is video games.
But you don't
competitive
like saying
video games.
You're like, it's esports.
It's esports.
It's competitive video gaming.
So the thing about traditional sports is that it teaches kids a lot of characteristics and traits that you can't really learn inside the classroom.
Yeah, sure.
Sportsmanship, humility, teamwork, working under pressure, companionship, camaraderie, learning how to lose, learning how to win.
Right. Hand-eye coordination too, for sure.
Definitely, but thank you, Jason, for that. But obviously, that's limited to a select student body.
Not
right?
everyone is
Not
a star
everyone
athlete.
can do that.
Right.
So, esports provides all those same types of lessons to the students, but it hopefully reaches a different type of demographic. So, it's an opportunity for other kids to build those types of skills.
Right.
So.
And so just tell us, because we did do a story on it, and we're going to get Al on tomorrow to go into more detail, but just what do you know? I mean, what kind of games are we talking about? Obviously, it's not going to be like Call of Duty or
Sure,
whatever.
yeah. So this is just a pilot program. I know Al.
That's like the only game I know. Was that cool or what?
Yeah,
Call of Duty is cool.
That was very spot on.
Yeah.
Excite Bike.
It's a game, kids play it, right? But
so what about the Tecmo Bowl?
I think Mr. Grito and the superintendent, they really wanted to get something out there for the kids to play during this fourth quarter with everyone locked down. So they agreed on Super Smash Brothers Ultimate, which is a very popular game. Has like Mario in it and Donkey Kong and all the Nintendo little characters.
Wow.
So I think all the public schools are involved. I'm not sure, maybe one or two might have opted out. But it's open to all students, even if your school doesn't have a team. So if you go to the GDOE Twitter, there'll be contact information where you can contact a school rep to sign up for the league. And the league, I believe the signups end on May 3rd.
Right, which is right around the corner. I think that might even be Saturday. Yeah.
Yeah.
Okay,
right around the corner.
now we're preaching to the choir here for people that are into esports and the gaming community, of which you are, probably like the Pied Piper at this point, right? You're very good friends with like a lot of those members. You know the who's who. You've brought many of them together, right? But for people, especially students that maybe fair weather into games, they don't really do like the community thing. Esports is an established industry, and you can actually make a career out of this. You can even go to college on a scholarship for this. So this actually has practical applications going forward.
What world are we living in?
Sure, definitely.
No, I mean, it's crazy. You wouldn't. When I was in high school, they would never say, "Dude, you could get rich and be a YouTube comedian or whatever, or you could play video games and make a job out of it, or you could go to school to learn how to play Donkey Kong."
Sure. So there are college or scholarship opportunities in college, as well as pathways into different types of fields in the industry, like whether it be game design or programming or even event management or marketing.
Right.
There's obviously, somewhere to go there with your educational path. So it's nice to see. I'm really glad to be involved at all within. I think Mr. Garrido and the superintendent are doing a great job. And actually Tegan Brown, who is the head of this league, he's a young guy and he's got good vision, so we'll see how it turns out.
Okay, now since you know the pulse of the Guam gaming community again, right? This is going to be like a within the context of the ISA, it's going to be a competitive league. But how is the caliber of Guam's gaming community like relative to when we play over the internet against other people like in the States or in other parts of the world? Like how competitive are we?
in other words, do we have those Guam gamers who are going to put us on the gaming map?
You know, we did the PXC for many years,
Right.
and then even back then when the MMA was new on Guam, I think a lot of people had the vision like these particular people are something special and they can really develop far in the sport. And we have those. We have UFC fighters, John Tuck, Frank Camacho.
Right. So who are the John Tucks? And
There are a bunch
Frank,
of them.
the Cranks of the gaming
If you
world?
thought there were good like MMA guys on Guam, there are really good gamers on Guam, and there are a ton. So I'm really excited to see what the new generation brings, especially when there's something like the school system there to support and help develop their talents over time. So it's a great step. It's a great step forward into that.
And if I can just ask, because as a former like gamer, you know, like Chris and I are the same age, but I mean, I could not hold a candle to the way these kids like play these days. I mean, they are truly like talented athletes. They work on their craft. I mean, they hone their skills. But if I just want to watch and be a casual observer and everything like that, are these sessions going to be like put on Twitch either now or eventually, or can we see like a live stream of this?
I can't really commit to what
He
will
doesn't
happen,
know it,
but
yeah.
I know that it's in talks to have those future events streamed. So maybe the finale.
And is this
so-
something that they're just going to continue after the COVID?
Yeah, we'll have to see.
When the
Hopefully
COVID-
Al can answer those questions
Right,
tomorrow.
yeah.
I would think that they've really taken a big step forward. This is very committal, in my
Right.
opinion. So I would expect to see.
Because
it.
I got to tell you, as a spectator sport, esports are fantastic. I mean, you could, if my school was there and I wasn't like one of the participants and everything like that, I would absolutely want to like cheer these guys on.
Yeah,
I got a
it's
comment
gonna be
here,
cool.
guys. Help! These two are geeking out massively.
Oh my god!
They ain't talking about me.
Trust me, you have just scratched
you
the
are talking
surface.
the most. I'm just answering the question.
I know. And then we have another comment. Ken, is that product in your hair?
It's not. It's not.
That's the COVID
It's
just
a rough
showered
day.
look.
It's a rough day.
You got to get with Auntie Lou. She got a friend that could do you up real nice,
You
man.
can get me the contact number.
They got to blindfold you, though, and they got to drive you all around the back streets so you don't know where it is, and then you get down. And okay, so now back to this. Tell me the games again that you heard they're going to be featured in this esports.
For
thing.
this one, for this pilot program, I know it's Smash Brothers Ultimate. So I
I never
know
even played that. Is that a Mario thing?
It's a Mario thing.
So what do you do? You're smashing.
like
It's like,
Nintendo
it's like
All-Stars.
Street Fighter, but it's just Mario character or
Ah,
Nintendo.
so you can get
characters.
Luigi to fight like the dinosaur.
Yeah.
What's the dinosaur? Yoshi.
Yoshi.
Yeah, you can.
Wow.
Yeah, it's like that. That's the first offering, and I know there's a bunch of games and titles that were discussed. They have a meeting with a bunch of the athletic directors from the different schools.
And are there
staff.
enough of these games that aren't like the first-person shooter games that kids in school could play?
Yeah, there are.
Give me some of them.
League of Legends. It's one of the most popular games in the world at the collegiate level.
NCAA
Smash.
type stuff.
There are, and there are all those games, NBA 2K, all the sports emulated video games. There's a game called Rocket League. It's like soccer but with vehicles. It's kind of interesting.
See, that's what I'm hoping they do too. I hope they get into like the sports side of esports too, because again, spectator, that'd be great, but also
I just
like,
want to
playing it, that's
respond. Mary Cruz writes in, is this newsworthy? Mary, yeah, it is.
Sure.
Because the Department of Education is trying to find a way to engage the students out there and dealing with these stay-home orders. Obviously sports. We can't even reopen gyms. So if DOE's doing things to bring the kids together, to offer some type of sense of community, I mean, just because it's video games, don't hate.
I mean, we still have teachers doing the virtual
They're
classes
doing the distance
right
learning,
now.
of course.
They're,
Right, yeah.
they're, like the effort is made, and I really think GDOE, they're of all the government agencies out there, they really.
I just did a
take
story
the
on
initiative.
the grab
they
and go
really move a
meals.
lot.
Yeah, they took the initiative on that. They're like the biggest COVID heroes in the entire government of Guam.
In my opinion, too. So I really think, I think it's a good step forward. It's a small step. Obviously it's for the kids. But yeah, it's going to turn out a positive product in the future. So
Okay.
Al should talk about it more tomorrow,
Right.
I'm sure.
What about like Pac-Man?
No Pac-Man.
They should do like a Throwback Thursday, and it's all like Pac-Man and Frogger.
Yeah.
You guys are looking at me weird.
okay,
Why are you
okay.
looking
Now-
at me
now-
weird?
now we're
Tell you what, if they want to add Angry Birds to this, I will mess somebody up in Angry Birds.
How about Clash?
No,
Yeah.
We'll think about it.
Okay. Ken's like, that's not a real video game.
Galaxian.
All right. Thank you,
Thank
Ken.
you. Thank you.
Yeah, the story's up on KUAM.com. It's on our Facebook. They got some comments on there. And that is, once again, let's give him his due respect. He's like the John Tuck and the Frank the Crank of video game players, all in one cute little package. Ken St. Nicholas, and you're okay too, Jason. Thank you. We're going to take a break, and we're going to keep on education here. And I got someone out there that we're going to get on the line to tell us a little bit about a problem they've been having involving private school tuition. That's next on the KUAM News Takeover, Guam's favorite, Containing COVID.
You know, these days even the Colonel stays at home. But when I get a hankering for some good old KFC fried...
Be healthy. Be informed with ITD.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc. Be healthy. Be informed with ITD. Be healthy. Be informed with ITD.
Should hear Sabrina sing this.
That's cute. My emergency kit.
Broadcasting to you with the lady in red this morning. That's Sabrina Sauce Mantanani. My name is Chris. This is Containing COVID. 29th day of April. Community testing continues this afternoon at the
Estumbo Gym.
Okay, so what do you got?
Okay, yeah, like you said, community testing continues at Estumbo Gym, and it is for everybody. Everybody that has COVID-19 symptoms, loss of taste, loss of smell, go to the Estumbo Gym from 3 to 6 p.m. today. Then the expanded community testing moves on to the central part of the island in Manila, and this is for the central villages to go and get tested. That is from 3 to 6, and that is at the Manila Senior Center. Then on Friday, moves south for southern residents. All southern residents with COVID-19 symptoms go to the Agate Senior Center to get tested from 1 to 4 p.m. And also as a reminder, if you don't have to go to these clinics, you can also go to your private clinic. You can also call the Department of Public Health's community health centers and get tested there, and it is free.
All right, 9:38. We talk about the Southern community testing. We name dropped them a little bit ago on the show. We bring on PD Mayor, Mayor Jesse Alec. Good morning, Mayor.
Hi, Mayor Alec.
Good morning, Chris and Sabrina.
I guess just first of all, so we're lumping the South down in Agate. When did you get the heads up about that, and how have you been telling your residents that they need to go to Agate on
Friday?
On Friday. Well, I got the message just the same time everyone else got it through an email from Public Health. I think it's probably the same time you guys got it. And we don't, I heard you earlier about bullhorns. We don't use bullhorns in PD. But we use email and we use WhatsApp, that's for sure, and telephone calls.
Right.
So, I sent out the email to our residents. We have a good village database, and we have a community WhatsApp group, and of course we call all our Manamco, and we call all our residents that don't have email or WhatsApp.
Mm-hmm.
So for the most part, we've got that out. I think the biggest issue that most have, and perhaps I do too, is the testing of asymptomatic residents. Most are calling back about wanting to take the test, but they don't have symptoms. And I know we joke around about what Mayor Zavar said, but quite honestly, perhaps they do need to say that they're not tasting food and they're not smelling right and what have you.
Right.
Because I think we'll get a better sense of how we need to move forward if we test asymptomatic residents.
Especially when you read a lot of the national media reports, and what the medical advice has been is that these asymptomatic people are spreading it out there. And but you're right, in doing this testing, I mean, we're not saying just come one, come all. We're saying only if you have symptoms
of COVID.
And now we're even encouraging people to lie about having symptoms just so they can get tested, which is, I mean, it's crazy.
Yeah, it is. It's crazy because, the amount of people that call me directly are asymptomatic, and they're in that population that's more vulnerable, right? We're talking about 60 to 70-year-old residents. And if they want to get tested, they don't want to lie. And what do I say? Go ahead and lie.
You're right.
Yeah,
Why
I'm
not?
gonna tell them that.
I don't think you would be the first.
There's precedent in the Mayor's Council.
But it's we all agree, and most of us agree, that we need to test the asymptomatic residents, and that's for the PD residents. They know that they should go immediately and get tested. And earlier, again, Linda did a great job about promoting the community testing. But again, I think it's a disservice because we don't test everyone. We only test those that are symptomatic. And
right.
We'll never get to the bottom of this if that's all we're testing. And I'm glad we're testing more. I'm glad we had over 100 tested the other day. But we need to test others, like I said, the asymptomatic.
Right. So I wonder, going back to what Linda had said, when we do this week, she seemed to indicate that they're going to continue community testing. So, like you said, I'm thinking if we're going to do the asymptomatic, we open it up and we just say, anybody who wants to come get tested, come get tested. And then maybe we could break it down by, this day, anybody who's age 60 to and up or whatever, you know what I mean? You guys come, whether you got symptoms or not, we're going to test you.
Yeah, because that might be, further down the line that they're going to do this, but I think they're trying to get everybody that has the symptoms.
And maybe sick right now.
Yeah.
I get it.
I mean, this weekend she said that they were going to go to the congregate homes, they're going to go to Hamlani, they're going to go test the homeless. So.
Well, the other issue is that the good issue is that there's backup tests. So if there are backup tests and there's enough tests, then we should open up to everyone,
Yeah,
so that
I hear you.
we get the answers we need sooner, and then we can worry about recovery.
Yeah.
And I think so. Talking about this brings me to recovery.
Right. What are your thoughts on that, Mayor?
Well, my biggest issue, and I know some of the mayors know that because I brought it up, and our executive director knows it, recycling, and we know residents. They've been calling about the recycling bins not being picked up, and then other recyclable items. But at the end of all of this, I know that we're worried about the economy. I am. We're worried about the future of the health of our island and our people. But that we also have to be good stewards of the earth, and I'm not sure what our plans are for recycling. There's all this money in the recycling revolving fund coming from EPA, and I'm sure Nick is listening. But we need to get that moving so that we can do our jobs as mayors and pick up all the recyclables that are out there, because everyone's cleaning their home. And, they're all home, children are home, mom and dad, they're all home, and they're cleaning up. And at the end of the day, they have junk and they have recyclables, and there's money that needs to be spent properly, and we need to spend that. And that up to now, we don't have a plan. I know we don't have money in PD at least for recycling, but I know there's at least $1 million hanging out somewhere, and that definitely needs to be part of the recovery plan.
Oh,
so
good.
I know that there are other parts to the recovery, but I'm hoping that while they're planning about the trash that's left behind.
It's too bad there's no representative from the Mayor's Council on this.
Recovery panel of advisors. Or is there? Are we just missing it?
Maybe.
Well, I'm not on it, and I'm not sure if the president is or the vice president.
Right.
But I'm not clear about that.
Well, you know what, Mayor? If we had a recovery panel of advisors, you bet we would have you guys on it.
Thanks. I'm sure one of us would definitely want to be on it.
I'm really not trying to use my wand as much today, but if I got to do a spell to maybe again call for mayor's involvement, Sabrina said no.
Go ahead. Do you, boo.
I'm going to do a double wand on this, all right? Okay.
Well, and then if you let us know in advance, or you talk to us about it, and let us be part of the solution, as far, instead of giving it to us at the end of your talks and the end of your plan, maybe.
Here, mayors, go do this.
Right,
that's what
exactly.
it is.
Yeah.
I mean, it's a shame because I've sat in these mayor's council meetings, and you guys have good discussions. You guys have a lot of different ideas, and I think at a time when we're looking at, especially recovery, reopening, there needs to be a lot of voices at the table. It can't just all be yes people. You know what I mean?
Correct. Just like the homeless situation, and we all deal with homelessness. I mean, even in PD, in the small village, I know for sure we have at least one homeless case, and we all have ideas as to how best to deal with the issue. But I'm not sure, and I'm not sure if anyone was brought to the table from the Mayor's Council to talk about the homeless population and the testing. And I know Mayor Tavares and Mayor Rivera, they're really big on it because it's bigger than the Hagåtña problem, right?
Right.
So, like I said, if they brought us all in to help with that, I think we all might have one great idea.
I mean, Lana, by the time they get these homeless sheltered, the COVID's going to be over.
Yes, I'm out quoting my guy like that.
I mean, geez, maybe loop in the mayors. Alakazam, Alakadoop, please keep our mayors in the loop.
You got him going, Mayor. You got him going.
Biba Guam.
Biba PD.
Biba, my guys.
Okay, so Mayor.
Oh wait, I do have one other. I have one. Can we end my conversation on a positive note?
Sure. Yes. Okay.
So I try to do different things for the village and for the children in the village and our manamko, and it's I haven't seen them in a long time. So we're doing a social media challenge for Mother's Day. It's the I Love Mom social media challenge. We put it out. So if there are any residents in PD that are listening, check our Facebook and Instagram. Check your email because it's a video contest for children to record a short I Love Mom message and
Wow,
post it,
Mayor.
and
We're
They
gonna
win.
promote this the next few days for you.
Cool, thanks. I appreciate it. Yeah, so it's on our Facebook page and Instagram, and it's simple. But we have other things coming down coming down in May because it's Manamco month, and we normally have a big, we normally do something big for Manamco every May, and so you'll be hearing about that soon.
Mayor, just one last question. I'm sorry, but how many people do you anticipate from PD heading over to Agate on Friday to get tested?
Well, all the calls I received they're all asymptomatic.
Okay.
And if whether or not they want to tell a white lie, then you'll probably have at least 10.
Okay.
But if you want to tell the truth, I'm not sure how many would actually go.
Right. And remember, they could be asymptomatic, but then according to what Linda's saying, if they have diabetes, any kind of lung disease, any other types of chronic illness, then they would also be eligible. So, you could throw I don't know why you would, but you could throw something in a crowd of Manamco and, you would probably 7 of the 10 maybe have diabetes or any of these pre-existing conditions. So maybe we try one of that before we go to the white lie level.
Well, you know what? And I didn't hear that. I didn't hear Linda say that, and I've never seen it out in writing. So that's certainly a good twist, a positive twist. I mean, if the resident has other comorbidities, then most of us do, including myself.
Right,
so
you're right.
If that was on the flyer, that if you have other underlying issues, I think more people would show up.
Can you send us the flyer, Mayor? You're right.
Yeah, I'll send you the flyer, the
Thank
ones
you.
that I received. But I think if we can communicate that to public health, and I can do that as well,
Right.
then you'll probably have more people show up. But a lot of people are concerned about, them not being, about them being asymptomatic.
Right, yeah, and I think that's because that's the foot that she's putting forward is she's saying, hey, if you have any of the symptoms, and then deep breath, and also if you have chronic illnesses or, pre-existing conditions, comorbidities, then come get tested.
Right. I mean, that's huge because there's so many of us.
You're right.
With
Yeah.
those conditions.
So, I mean, if you apply that criteria, it kind of seems like maybe we would have a lot more people covered.
Right. And I'll send that out to my people for sure.
Okay, Mayor. Appreciate it.
Thanks, Chris.
Take care.
Yeah.
Okay.
Adios.
Stay transparent. Wash your hands.
I just wanted to.
Thank you, Mayor.
Thanks, Mayor. I just wanted to comment on Harvey's comment here on our Facebook post regarding testing, and I know he's saying that testing is at SDA is not free, and that was based on a comment from our caller yesterday, Ed, who had an experience. He has comorbidities, and he went to go get tested. And according to Linda, she did say that the testing is free, and this though is for the patients who are who have COVID symptoms. So that's just the clarification there. And I know this was also brought up during the press conference, I believe on Monday, and the governor was mentioning that there's a law regarding health insurance companies and charging for testing. So we can look into that a little bit further today, and maybe there's going to be a press conference at 1 o'clock with the surgeon cell and some of the physicians, so we can ask them just to clarify everything with regards to the cost of testing for COVID. Okay?
Yeah, and I know that when Linda was on, her specific quote was testing is absolutely free.
She said absolutely
that.
free for people with COVID symptoms
Yeah.
that are going into the clinic.
Yeah,
but then there were also questions about, could it be anybody that goes in there to get testing for COVID, in which Dr. Hoa Win was on our show last week saying that it was free. So there's been this ongoing confusion that hopefully, because there is a press conference today with the surgeon cell, we can just get the straight answer.
Yeah.
Okay.
So again, I mean, if you're trying to hack it and you don't want to pay, I would just say go to public health clinic. And I mean, if we're going to be telling white lies, or that's what the mayors want us to do to get tested, then say, I don't have insurance. Just get it for free.
Linda even today was like, just come in. Just come in,
and that kind of seems to be her take is like, we're given this criteria, but
she's not saying lie, but
Yeah,
she's just saying come get tested. Okay.
She's saying come get tested. But obviously we want as many people to get tested as we can so that we can kill this curve.
You just got to be careful because, people that are going to go get tested are people, they're wanting people who have COVID symptoms to go. So if you're going to go, be careful.
Wear your mask. Definitely. You got to wear your mask when you guys go out. And it's sad is a lot of people can't even afford masks. Like I was went to check out the Grab and Go yesterday, and it was like nobody was wearing a mask. And I know they're in their cars, but it's tough. Got to protect yourself, guys, at all times. 9:53. Let's go to the phones now, where we always try and end the show on a good note. And we had a little taste of a good note there with Mayor Allig and what he's doing for Mother's Day. But I wanted to bring on Bert. Bert has kind of been doing something cool. But first, Bert, can you just introduce yourself to our audience? Tell us, what you do normally.
Hey, what's happening, man? Chris, this is Bert. I actually own Chronic Hobbies. And I think you've been on my shop before.
I have, yeah. You do some guns, some airsoft stuff, right?
Absolutely. Yeah. It's a big boy toys shop.
Right. And I actually went to your shop because this was the time that there was the whole gun grab thing with Ray Tenorio, and I was trying to get to film a You remember when I did that story with the reenactment?
I think everybody remembers that.
Oh, okay. Yeah, so I thank you for that, Bert. It was very nice of you to help me out and to show me, pointers about the logistics of that gun grab thing. Kind of random.
We're all about whatever we could do to our community, then we'll do it. If we can help, if we have the skill and the ways and means to help our frontliners, we would do it. Whoever needs help, they can come up to us, and if we have the knowledge, then we will share it. Same thing with what we are talking about now. A lot of these guys seen all these Facebook ear savers, and then actually my sister-in-law works for FHP, so she called on to me and she said, "Hey, can you make these?" I said, "I can."
Okay, and let's go back, Bert, just to give people some context here. Bert, was it just you, or was it your staff, your family that kind of organized this? Let's go back to the beginning.
How'd this come about?
Yeah.
No, actually, I have a lot of friends on the medical field, and they've been trying to, tell me about the ear irritation. And some people don't realize that the rubber that they use on some of these masks are actually, you could get allergic to it, and then you would get rashes after wearing it for quite a while. So the ear savers actually keep that rubber away from your ear. So when they contacted me, for some reason, a lot of these nurses, they know each other. So by donating to FHP first, and then all the other nurses found out, hey man, we got Bert that's been printing these things 24/7. I have 3 printers. They're actually printing as we speak right now, and I haven't stopped.
3D printer?
3D printer.
Yeah, 3D printer.
I have 3D printers, so I use them for my business, but I have extra materials that we kind of don't use, so I use those to actually produce these things, and I just donate them. And, a lot of people always question, hey, how much do they? No, we don't. We're donating them to the frontliners. And then people in my villages, of course, if I go to your gas station and I see you wearing masks, I'll just hand it to you. I have some with me all the time, so.
Wow. And how many have you donated, and who exactly have you donated to? I see GMH is definitely one of the...
And then FHP, I've donated to Guam Medical Clinic, a bunch of the medical clinics, even the clinic in Tamuning. So a lot of the guys that knows me, they see and hear this news. They actually contacted me and said, hey man, can we have at least 10? So I usually take tabs on who gets it, and we don't really make money out of them. We just donate them. Actually, the thing is this. My business is closed because I'm considered non-essential. Right. So instead of just staying home, I'll just do this until they let me open my shop. So
how long does it take to make one of these ear savers in your printer?
Actually, to make 10, it takes 3 hours. So it's not as fast as printing it on a paper like people. That's why we explained it to them. Like, it's not like a regular printer on a paper where it comes out in seconds. No, this thing actually prints pretty slow. But I do have 3 printers that are, pumping out these things every day.
And these are a thing, Bert. I didn't even know what ear savers were, and then you Google it and you see that nationally there's a demand for this. That frontline healthcare workers, their ears.
Absolutely, man, absolutely, because it does irritate, like especially the FHP worker. They say they wear their mask for like 10 hours a day, and it takes a toll on their ear. And I've seen some nurses where they've actually developed rashes behind their ear. And that's why I said, man, you guys start using these things, and it once you wear it, the way I designed it to is it actually compounds to your head. So after the end of the day, it's bent, or it's already like you're not even wearing it anymore. You don't even feel it.
That's some engineering know-how right there, especially for us guys with bigger heads. It's good that there's options.
We have it's adjustable. There's actually 3 steps.
Okay.
So also we did that because some masks are not manufactured the same. Some have smaller rubber band and some have larger rubber band. So we made it where it's adjustable.
Okay.
It's basically one size fits all.
Wow. Well, Bert, we just wanted to bring you on and kind of recognize your efforts in this part. This is something, there's just so many areas of need with this COVID-19 crisis, but for you to look at the big picture and see the little things that will make a difference for our frontline healthcare workers, it means a lot to us. And we just want to tell you that you are a COVID hero.
Thank you, sir. I'm just part of it, but the real heroes there are actually the people that works on the front line. And just for me to do this, man, it's an honor actually for them to. If we don't take care of them, if we get sick, who's going to take care of us, right?
Well said, Bert. Well said. Thank you. Thank you so much, Bert.
Thanks, Bert.
God bless you.
Be safe.
Wash your hands.
Thanks, Chris.
God bless you. Okay, Bert.
Bye.
There you go. That's Bert, of course, from Chronix Hobbies, right down the road here.
Chronix Hobbies.
Yeah.
So they sell what? Games?
Drones.
They sell drones, games, pew 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 pew. They sell the pew pew.
He's a really, really good guy. I mean, kids come into his shop. He's like, hey, are you interested in remote controls? Let me show you what we got. I'm not trying to make money off you and your family. What are you into? Let me hook you up with the right stuff. He talks to, like you said, like the air gun community. He's always been accommodating for like drones and stuff. He's helped GPD numerous times. He's always at the Relay for Life. He'll just be doing stuff. He knows that his gear draws attention, and he never just like backs away from it. He's like, oh, this is how it works. Let me share my passion with you. So hearing that is absolutely wonderful and does not surprise me in the least, because Bert is a really good stand-up guy.
Well, there you go. There's your character testimony for Bert. For Jason Solis. Hey guys, it's been a great time with you. As all things considered, I think we've all kind of evolved to live under these conditions. And when people talk about the people of Guam and they're resilient and they go through these disasters and yada 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 and we just bounce back, this is kind of what they mean. Is like we get thrown the worst hand of cards and we still somehow end up winning the game. So just want to thank again our frontline healthcare workers. Also I want to do a special out to the senators who went into emergency session, who sent the governors the bills that they thought our island needed to do, and who are now regrouping some of them and trying to find ways to keep our government, or at least get them to start being more transparent. Bree, anything you want to?
No, I'll just reserve my comment.
You guys got to see the after containing COVID show, because that's when Bree lets it fly. And that's a pretty small audience. It's 10:01, so thank you guys again. KUAM.com, I-94 FM 93.9, KUAM TV 11, the audio stream on Docomo Channel 10. Appreciate all your support during this COVID era. Okay, and again, it's been the KUAM News Takeover.
Hey, I want to remind people we've got Nestor's new show, In Full Zoom. He's going to be over the next, it's probably going to take a while as we track the recovery of Guam from COVID-19. He will be interviewing several different business people in the community to hear about their struggles and their strategy on how to recover from COVID-19. So that starts today. We'll have it on TV at 6:30, and then I believe at 11 o'clock, we'll have it live on KUAM Digital.
That's awesome because as you see, when we talked, I mean, just for a little bit, we kind of touched on the recoveries and the reopenings with a few of the doctors, and then just in conversation with ourselves, the comments are going crazy. Everybody's got their 2 cents and then some about how to reopen, when to reopen, what to reopen. So if you're one of those, you might, and who's not at this point, you might want to check this show out. It's going to be awesome. 10:02. Sabrina, always an honor.
Whoa, an honor.
What?
What do you want? What do you
I want lunch.
There you go. I knew there was something.
All right. Alakazam, Alakadunch, please make Sabrina buy me lunch. All right.
I got you. I
Okay.
got you.
Hey, so for Sabrina, for Jason Solis, for Joe Sir, for Ken Sanity, from our KUAM family to yours, thank you so much for listening and watching Containing COVID. Guahusi Chris, Esta, Joe.
Bye.